Whew. Welcome to what will be a shit show of a night. Normal America Show with Rob Noor. What is going on? Oh, man. We're going to try our best here. Give me a second. I'm going to have to monkey with my camera. So 1 second. Is it working? Check. How's the audio sound? Hopefully that's all right. No, slow. Okay. All right. So, this will probably not work. This stream's probably not going to work. As you can see, I'm not home. I got called into work about an hour ago. I'm off the clock, but I have to be here. I'd made a commitment to do this debate. The emergency that got me called into work is such that I could very well be here for the next 2 months. So I can't really reschedule. So here it is. Here we go. So all my research on COVID is at my home computer. I don't have access to any of it. There's nothing I could do. So it is what it is. In addition to that, we have major thunderstorms coming through that has a good chance of knocking my power out. So we're gonna plug through as best as I can. What's likely to happen is my computer will overheat, and then I will be unable to record or stream this. So I hope that Tom or Elderdrazi are recording or streaming this, because what I would do in that case is call in on my phone to their Discord and try to do the debate that way. But I don't know what else I could do. It's sort of out of my control. Let's see if I can fix this. It's unfortunate. Originally, I was supposed to work this Saturday, and then I got the call off, so I told Elderdrazi I'd be able to do this debate, and then at 4 o'clock or so, I found out that I was going to have to come into work. So, it is what it is. We'll make the best of it. Like I said, hopefully you could go to Tom Foolery's channel or Elderdrazi's channel if my computer overheats. Hopefully it doesn't come to that. It would have been nice to be at my home computer with sort of some of the resources I had available for some of the research that I've done. Now, to be fair, I haven't done any preparation for this debate specifically, but I do, when I do debates, keep folders on information that I find and things that I research. It's nice to have access to that. It's nice to be at your home computer. So we're gonna fly by the seat of our pants anyways. Man, this camera's really it chaps my ass the way it's glitching out. If you were gonna catch me on a good day to beat me in a debate, this would be it. So Elderdrazi, good luck to you. It's the topic that you're an expert on, that you've read more than any human being on, that it's your best topic, that you don't have to be polite, he said, or pleasant. All true. That's great. You don't have to be polite or pleasant. Moderator that likes you, and I am completely off kiltered because my entire month and a half to 2 months just got knocked out because I'm probably going to have to be at work for like 60 straight days here. Hopefully not. Hopefully the emergency that put me here will be resolved and I'll be able to have a life again. But it sucks, man. I had plans. I was hanging out at my brother-in-law's place with my son and my wife, and we were swimming and stuff, and then all of a sudden I get the call, gotta come in. So it is what it is, but no excuses. I'll still kick ass. It's nice to win even when everything's against you, so it'll be fun. That could be it, Steve. That's one way to resolve things, just no longer living. I have to give me a second. This might be done without a cam, unfortunately. Okay, let's hope that fixed it. Everything, all of my, like the microphone, I got a cheap like $40 Blue Snowball mic here. That's the only thing that's worth a shit. everything else that I have here, my computer's garbage, my camera's garbage, my headset peters out half the time, but we'll make a go of it. So I still haven't heard from Tom. Let's see here. First, I want to. So bear with me as I try to. Let's do this. Okay. Tom's live streaming. Yeah, he was supposed to send me a link. I think we're just doing it on his Discord, so. Someone got anything? Yeah, Spur, I could probably do that, sync that stuff. It's something I need to try to work on at some point, but for various reasons, I don't like streaming when I'm not at my home office anymore, except on my phone anyways. So this is a rare situation. I never plan on doing interactions with people like debates or interviews when I'm at home, or when I'm not at home, but if you get called in, you get called in. What can you do? So, it'll still be fun, though. There's no excuses. I'm prepared to debate. It's the technology and stuff that'll crap out on me, if anything. So, if I have to do it via the phone, I'll do it via the phone. No problem. So, let's see if I can get a hold of Tom here. Clicked on his room and couldn't hear him there. That's about. Let's see if I have audio through my headset. Maybe I don't. Let's try to. Oh, what to even do? Here, we'll probably crash my computer right here trying to play a video. Let's see. My channel. Turn this fan off, it's probably. So my work office, the air conditioner went out, so it's in the. Okay. Alright. I think the camera's looking a little better now. Hopefully I fixed that glitch. I think there's like a short in the wire. Sometimes you have to twist it about and then unplug it and plug it back in. Good stuff. Let's see. So I don't know why I couldn't hear Tom there when I was in his room. Anyway, so we're waiting. I was in his room. I was right behind the curtains. So the debate's supposed to start at 7, so that gives us 8 minutes. Sun peeked out here. We were getting some bad thunderstorms. We had some power flickering, so I was like, oh great, throw that on top of everything else. Check my phone, make sure I didn't get a link. Nothing. Nothing at all. One of the things I think is funny, even when I'm having like incredible difficult problems like this, like get called into work, I have to use inferior equipment, etc., etc., etc. It's like I'm still on time. I'm still ready to go. Where's everyone else at? Whatever. Thanks, D Gulag. I appreciate it. Yeah, we'll see how it goes. Hey, Tom. I don't know if you could hear me. I can't hear you.
I hear you.
Okay. I heard you there.
Wait, you do hear me now?
Yeah, I can. You're very soft, but yeah.
Yeah, sorry, my mic is really quiet. I got a Focusrite thing, and it makes it really quiet.
Okay.
I guess I can try to stay close.
That's all right. I could up your volume, I'm guessing. So, let me get my camera ready.
I am live, by the way.
Yeah, that's fine. Me too. Let's see. User volume. We'll up you. Okay. This is where we were supposed to come, right? Just your channel here?
Yeah.
Okay.
Yeah. I was just getting ready to send you an invite and saw you were sitting there.
Yeah.
So I just sent Drazi one.
Now listen, there is a 90% chance my computer is going to overheat, or that the electricity is going to go out because we're scheduled to have thunderstorms. So if that's the case, I'll call back in on the Discord with my phone. If that's the case, either you or Elderdrazi, I don't give a shit which, would you mind if I rip your stream for my channel just to put up a video of it afterwards?
Yeah, no problem.
Okay. Hopefully it won't happen, but it's not even worth getting into. I do home health care. I was supposed to have off until tomorrow at 3. There was a legal emergency with a coworker of mine, and so I had to come in, and I have no clue when I'll be able to go home because it's only me and one other person. I could literally be here for months, so I can't even reschedule. It's not like, oh, we could do it tomorrow. I just have no clue. So I was like, fuck it, we'll do our best to get it done. But I normally don't plan debates unless I know I'm going to be at my home office, because there I know the computer is good, the internet's good. This old rig I have in here, it overheats if I try to do anything, so we'll see what happens, though. I tried to turn down all the settings and what I have so that it's,
Have you ever had to stay there for months at a time before?
The longest I've had to be here was one time, ironically, during COVID. I had to be here, I think, 29 days in a row.
Damn.
And that was at the height of COVID.
Like without going home?
Yep. So normally, on a normal week, I come in on Saturday at 3 and I'm here 24/7 until Wednesday at 2. But then if the coworker takes off, so just a regular week that my coworker takes off, I would have to be here Saturday at 3, then I do my shift till Wednesday at 2, then I do his shift, which is until Saturday at 3, then I do my shift, which is till Wednesday at 2. So any day that any week that my coworker takes off, I'm here 11 days straight. If there's 2 weeks that they take off in a row, then I'm here 18 days straight. So it's definitely happened many times, but the longest I've been was like 28, 29 days, something like that. Which it sucks, but it's not like, I'll be honest, I kind of still find ways to like meet my wife for lunch or something like that while I'm here. But it sucks. And it really sucks when you're trying to do not just streaming, but anything. Like, you set up like, hey, we're going to go to the zoo. We got tickets, or we got tickets to go to this show. Well, you just can't go. I've missed concerts because, someone calls off or something crazy happens like this. Most of the time it's a medical emergency. Like when you have to come as an emergency.
I had a year that I averaged 90 hours a week, and it was that I've got fucking PTSD from that year. Like that was the roughest year ever.
So I have. It's it's weird the way it works. I'm here and I'm off the clock, so I'm not getting paid, but I have to be here in case an emergency would spring up. There has to be someone on the premise. So ironically, I work at a minimum half the week, and that doesn't include then trainings I have to do or office related stuff outside of that. But I think I average getting paid about 95 to hours a week, around there. So that's what it's been since last Thanksgiving, when the third staff that was here got fired. And I'm really hoping that the second staff didn't get fired, because that leaves me here in perpetuity. And the problem is no one wants to do this field, so it's really difficult to hire people, and it basically pays like garbage. So I could be here for a long, long time. It helps that I really like the people I take care of, and it's not a difficult job. I really enjoy what I do. But it still sucks being away from your family and not knowing if you could plan to do things, because anything could happen. Where's Elderdrazi? He's chomping at the bit to do this debate. I thought he'd be here early.
Yeah, I did too.
He said sometimes.
I've already sent him a couple DMs.
Yeah, we'll see.
So he said lockdowns and mandates.
Yeah.
Is that right?
I really don't give a shit. We can talk about whatever, but if he wants it structured, I figured we should each take a topic that we wanted. He wanted to talk about lockdowns. I figured we'd talk about vaccine mandates. If we have time and he wants to get into other things, I don't mind if it's loose. If he starts talking about other things within it, don't bother me. I was fucking with him online because I'm so tired of this shit. Every debate I ever do is fucking a panel of people against me. I talked to Destiny for 5 fucking hours under the assumption that we're going to talk half what he wants and half what I want. Then 10 minutes into what I want to talk about, he rage quits. It's always the same old shit. So, but whatever.
Yeah, I was the one pushing Drazi on it, because he initially said, we're going to talk about COVID. And I was like, that's not a topic, dude. There's 1,000 topics under the topic COVID.
Well, I assumed, Drazi's in here now. I assumed he wanted to talk about the shit we were talking about when we were on the panel. Because he reached out to me immediately after and said, do you want to talk about do a debate on it? I said, sure.
What was that?
But I don't give a fuck. Talk whatever.
Okay. You there, Drazi?
I was interested in talking about a broad range of subjects involving COVID.
Yeah.
Well, he said he's down for whatever if we get through the first two and he's still available.
The problem is
okay.
You should have reached out beforehand, because like what like your list of shit. Like you wanted to talk about Trump's failed response. I don't know if you were watching me when I was streaming in 2020. It was heavily criticizing Trump's response. So what's the debate? If we're gonna have a structured debate on subtopics, and the subtopics are shit that we're gonna agree on, what's the point? So I figured we'd take one from your poll and one from my poll, and that's easily 2 hours, like 2 topics.
Well, I have seen your stuff, and I just had some disagreements with some of the things that you did support Trump about, or some of the things that never got brought up, like the delayed vaccine rollouts and how it was directly tied to the Trump administration's refusal to push through the tests that were available, things like that.
Oh, you want to talk about Trump being a problem for vaccine rollouts? That's cool by me. You want to bring that up?
No, testing.
Oh, I thought you said vaccine rollout.
They knowingly delayed the rollout of testing in America.
Well, that wasn't just Trump. That was Democrats, Republicans, and Trump. For example, they had an emergency bill on COVID that was thousands of pages long that never mentioned PCR testing. That's something I heavily criticized Trump, Republicans, and Democrats for. No. So, I don't know. I don't give a fuck. Whatever you want to talk about, man. I don't give a shit. I really don't. I think it'll be boring if it's a bunch of shit that we agree on, but whatever.
Yeah, I just figured if we agree, we just move right along.
Well, hold on one second. Rob mentioned maybe taking call-ins, so if you guys want to do the first two topics, and then maybe some of that will come up later on.
However you guys want to do it. I don't give a shit. I was giving Drazi a hard time, but I don't give a shit. It's always the same with me. I debate what the other people want to debate, so have at her. I don't give a shit.
So, and then do you guys want like very hard lines on the topics, or do you want to just kind of like move on once it starts to settle down?
I prefer less structure.
Go
ahead.
Okay. The main thing that I'm looking for with moderation is that like if we're if him and I are going back and forth and we're just sort of looping on something, it's sometimes not very obvious to the two people that are debating that we're just looping. I'd like then to if you could be like, hey, you guys need to like you guys need to have some forward progress or we're going to move on? That's the kind of thing that I'm really interested in, because I know when I've been there, I don't realize it's happening.
Sure, that sounds good to me.
And
I think
it
the
seems to
less
be the
that
case
the
for most
moderator
people.
gets involved, the better. I think sometimes when you're too structured, what happens is you're in the middle of a very good exchange and back and forth, but because there's been these artificial subtopics or structure that's agreed upon, you end up then forcing yourself to move on to a less interesting point. So, however you guys do, it's fine by me. I don't care.
Yeah, we want to keep it like as natural as possible. So, okay, cool. So, and then 2-minute, like, do you guys want to do 2-minute openings or and closings on each one so that you're able to get last words in on each one?
It's fine by me. And what do we think? I could probably do 2 hours. I could probably go a little longer if necessary. Again, Elderdrazi, I explained to Tom, I scheduled this. I was not supposed to be at work. I just got called in as an emergency. My computer here sucks and sometimes it overheats. If that occurs, I will call in on my phone. But there's nothing I could do. I have to be here. So.
No, look, I understand. I just had to go run and take care of some things so that we could get dinner before everything closes. So I almost was late to this. So I'm very understanding.
Okay. But I'm good to go. 2-minute opening, closing, each one works, and then however we want to do it, call-ins or not, doesn't matter to me. It's fine.
Okay, cool. Well, if we want to start with vaccines then, and that one was Drazi's topic, yeah?
No, lockdowns was his topic. Mine was vaccine mandates.
Okay, so then if you want to do the first opening on this, Rob, and then we'll have him do the first opening on the other.
Yeah, sure. So, all right, 2 minutes here. So with both of these topics, my concern with COVID was always this. If you're listening to some fat guy like me about health advice, you're making a huge mistake. You should talk to a professional, a health professional, give your unique situation, and come to the conclusion you think's the best for your individual situation in your body. What I was against was the government forcing things upon people, and particularly in the way that they did it. If the situation arises where we have to accept that the government infringes upon our rights because there's some sort of emergency, it is incumbent on them to be as transparent as possible, open as possible, and to answer as many questions as possible. Instead, what we were told, we'll talk about vaccine mandates specifically, was that you wanted grandma to die if you disagreed with them, and they wanted to make your life as much of a hell as possible. The problem was they never articulated what their data was to show how those mandates were acceptable. So the question I have for Elderdrazi was, did you support vaccine mandates? And what was the literature you were looking at the time that these mandates were being pushed to think that it was worth violating people's rights and bodily autonomy? And do you think that the people that were encompassed under that vaccine mandates was all good? In other words, do you think that those mandates applied to everyone, at least the one Biden suggested was everyone that worked at a company that had more than 50 people, etc.? Do you think that all of those people should have had to get tested every week, as was suggested in his mandate, or forced to get the vaccine? There are other mandates that we could talk about, such as those in New York, where there was vaccine passports that were necessary to do common things like going to the grocery store that I think were appalling and set us on a path to tyranny that will be emulated going forward, that will further erode people's bodily rights and bodily autonomy.
All right, cool. Perfect timing. And then Drazi.
I can't hear you, man.
Yeah, you're muted. You're muted on Discord.
So, is that better?
Yes.
Yep.
Good? Okay. So, for the most part, I'm in favor of the vaccine mandates. There's a few areas where I think that it's gone too far. I think that if you want to go to the grocery store, you probably don't need a vaccine passport, kind of thing. But we already accept vaccine mandates in other categories, like in all 50 states, there are required vaccinations that children have to have in order to go to school, unless there's some way to prove that this vaccine is somehow less safe than the variety of other vaccines that are available, then I don't think that there's really a strong argument there, unless you want to hoot and holler about those as well. The vaccine is proven safe. The literature that I looked at was the number of people that were dying before the vaccine had come out. If you want to make comparisons to the flu or whatever, annual flu deaths were exceeded like easily in less than a week during peak COVID. So I think that anything that we could do to try to boost our numbers and getting people vaccinated in this country is essential, especially considering that the decent but not good enough vaccination numbers that we've had in the United States is one of the primary causes for the United States being home to a lot of the subvariants have taken over. Well, they had taken over throughout the course of the pandemic. Obviously, the most prominent one was Omicron, came from South Africa, but they had just slightly less than us in vaccination numbers. So yeah, I think vaccine mandates are very good, as long as they're not too insane.
And were you in favor of the businesses and all of that tested?
Oh yeah. Yeah, I mean, so if you want to say that it's tyrannical to make somebody get vaccinated to go to work, I'm really sympathetic to that. So sure, but like, it's not tyrannical to make them get tested. That's silly.
Okay.
All right, cool.
You ready for?
Yeah, we'll keep it at about an hour. Go ahead.
Okay. So the first question I have is: would you agree with me that we sort of have basic rights like the free right to assembly, which would include the right to go to work and be employed, the right to hang out with who we want, that it should be incumbent on the government to articulate why they need to violate those rights? Would you agree that the onus is on them?
Can you kind of rephrase the question in less words so I make sure that I understand what you're asking?
Yeah. So like we have a right to free speech, which entitles a right to free assembly, right? Like you can go hang out with your friends right now. The government doesn't have the
generally
right.
speaking.
Right. So you have
generally speaking, yes.
Okay. So then if the government is going to restrict those, then the onus is on the government to prove that those restrictions are necessary, correct?
Depends on what you mean by proof, but sure.
In other words, the default
go, hey, you can't
is
do this anymore because I said so.
Right. The default is we're allowed to hang out with people. We're allowed to go to work. And if the government says, no, you can't, it's up to them to articulate why that default needs to change.
Sure.
Okay. You agreed with the vaccine mandates, but let's just, real quick, let's talk about Biden's particularly. You acknowledged that mandate said every single person that works at a company over 50 strong employed through OSHA would have to get tested every week or prove that they were vaccinated, correct?
I'm pretty sure that didn't end up going through, but yeah, and I do agree with, but I did agree with it.
You support that?
Yeah, absolutely.
And do you think then if
they're not forcing you to get vaccinated?
Well, sure. Okay.
Which I think is
or they could. Do you think that the test was acknowledged as being unduly burdensome? Which the point was, as was articulated many times throughout the Biden administration by people connected to it, that the point was to make it as difficult as possible to convince people to get vaccinated?
I don't think that there was any official reasoning behind that. That was to frustrate people into getting the vaccine.
Okay. Do you think that it would be burdensome to force people to get tested every week?
No.
You don't think that?
No, people say, I think it's a bigger burden than just going and getting a shot, sure, but I think that it is. I mean, you just have somebody put a fucking thing in a cotton tip in your nose for 15 seconds. It's not a big deal. I've tested plenty.
Okay, I'm sure you have tested plenty. So I live in rural America. The closest facility for me to get tested is 50 minutes away. So you think I should have to drive every week and get tested?
I think you should just get vaccinated.
Okay, but do you think that would be a burden on me to force me to go every week to get tested?
Yeah, I think it'd be a lot bigger burden than going to your local CVS and getting a shot.
Okay, so you admit that it's burdensome. Great. Okay, then the question I have for you is, let me rephrase it. Let's set it up in a different way. Do you think that people that had natural immunity, who had already had a case of COVID, were more protected than people that had the vaccine?
It depends.
What do you mean it depends?
So if you were infected with the original strain of COVID, you are not going to be more protected by somebody who had an updated vaccine against, say, the Delta variant, which was the prominent one around that time. So, and I think that it's really hard to track people who have been proven to have COVID and then know what strain they had and see if they're going to be that protected going into a workplace where there's other people and maybe some people that can't get the vaccine for medical reasons.
Where are your sources?
So I think it is on you. I think that it is your responsibility. Where's my sources for what?
Your sources for the argument that those that got a vaccine of the newest variety were more protected than people that had a prior case of COVID. Because almost all literature that I've looked at back during the mandate time and since then has showed that people with prior COVID infections were less likely to have severe cases of COVID and less likely to get COVID than those that even had updated vaccines.
I don't have anything on hand per se, but are you telling me that you believe that if you got sick with the first strain of COVID, that you're going to be more protected than somebody who gets the latest strain of COVID that's happening right now, and than somebody who's vaccinated with updated vaccines?
Yes, I'm saying that the literature seemed to be quite consistent that people that had a prior COVID infection had longer and superior protection than people that got vaccinated. That is what I'm saying.
Even if
Go ahead.
So I don't have anything on hand that says that, but even if that was the case, which it's not, you are going to still be more protected. In the key point here, when I say protected, is that you're going to be less likely to get sick, and if you do, you're going to be less likely to get other people sick. The less likely to get other people sick is the key point here, because I think that if you want to live recklessly enough to where like you're not super concerned about your own well-being, I might have a personal issue with it, but I'm not going to try to stop you, really. I think that you have freedoms to make poor decisions for yourself, but when those decisions can end up putting the health and, in some cases, life of other people at risk who aren't signing up for that risk, then I think we have a problem. So I would say that it is.
So then,
I think that you do have a duty to make sure that you're not getting other people sick.
So then,
and I also don't think that death is the best metric here to use.
So then the steel man of your position, if I could, would be the reason that you were for this mandate and for forcing people to be tested that didn't have the vaccine was because we need to do everything possible within reason to make sure that they're not spreading the disease to other people.
Yeah, absolutely.
Do you think that under that mandate that it was a mistake to not say that people that were vaccinated should also have to be tested every week at work?
No.
Why?
I don't think it's a mistake.
Why?
Why?
Yeah,
because you are doing everything because you're doing everything that you reasonably can to not get infected, to not spread the infection. Even if you do get infected, you have a less likelihood of spreading it already.
What if I show you? What if I show you?
This meets the bar of doing your due diligence to protect the other people around you.
I think that this is blatant hypocrisy, because what if I was to be able to prove to you that actually the people with a prior case of COVID were not only less likely to recontract COVID, but less likely to spread COVID than the vaccinated? If the argument is, well, still, we have to be burdensome on them. Please, let me finish. We have to be burdensome on them because we need to do everything within reason to prevent the spread. Then why wouldn't we also force everyone, even those that were vaccinated, to be tested? Why can't we burden them as well?
I think that if you are vaccinated and you're showing symptoms, then you should get tested, because somebody who's vaccinated, I don't think has any. A vaccinated person who's going to work shouldn't have to get tested regularly, because they're not going to be the people that are more likely to have it. And I think that you're already doing what is required. Okay, so I'm curious, how far out does this extend then? If you're saying that the people who are vaccinated should also have to get tested every week, then by this logic, when you just say that like everybody, vaccinated or not, they should all just stay home and nobody should.
No, that's not what I would say. I'm taking the position I was against the mandate. You're taking the position you were for it, and that you're okay with the burden.
And I have a reasonable expectation to prevent people from getting sick, and I think that vaccinating.
You do not.
Requiring people to get vaccinated or tested is reasonable. I think that making people get vaccinated and tested is unreasonable.
That's not, your position isn't reasonable. The reason that, right, unless you're being vindictive intentionally to people that chose not to get the vaccine, the best faith interpretation of what you're suggesting is that people that everyone who isn't vaccinated should have to be tested every week. Let me ask you real quick here, if you don't mind answering. Even if they're not showing signs of COVID, correct? They should be tested regardless, correct?
Yes, because people can carry COVID without having symptoms.
So that
even
those
though that
people
is more rare. But if you're unvaccinated, those numbers go up.
Okay, so you're admitting that it's a burden, right? But you say that we should do that for the public good because we want to do everything within reason to prevent the spread of COVID. But then I say, well, actually, please let me finish. So then what I say is actually what we could see is that people that had a prior case of COVID during the times of these mandates actually was less likely to contract COVID, less likely to have a serious case of COVID, and therefore less likely to spread it. So if the argument is if those people should have to be tested and they're less likely than the vaccinated to contract and spread COVID, then why shouldn't the vaccinated also have to be tested? And your response to that is that would be unreasonable.
No, you're skipping over the part that I contested, which is if you If you contracted COVID that is the same predominant strain of COVID, then sure, you know what? I'd be fine with that. I'd say you have, at the very least, comparable protections to somebody who's vaccinated. I can see that 100%. However, people don't come in with their COVID. The people don't get their COVID test what strain they have. And if somebody got sick with a much severe variant of COVID, they're not going to be very well protected against contracting and spreading COVID from future variants.
If we were to look at studies,
the further away you are from that variant,
if we were to look
then
at
the less effective your natural immunity.
If we were
be.
to look, so
Same
you
as a
can,
vaccination.
you who's claimed that you've read pretty much everything on COVID, right? So you are unable to provide
For
any
about
of
the
this.
first year and a half, yeah.
Okay, so you're unable to provide any specific studies now, which is fine, right? But let me ask you this: in theory, what are the sources that we should go to? Name me a source that you think would be good that collected, like an organization, whatever, that put out papers that collected data, sort of looking at these statistics. Give me some organizations that you would trust.
Let me tell you this, Rob. I have never seen anything claim that any strain of COVID provides immunity to future strains of COVID that is in any way comparable to updated vaccine whatsoever. This has never been stated by anybody.
Okay, I'll repeat that. It's interesting way to deflect the question. I'll ask the question again. What sources would you trust?
I don't know if anybody has. What sources would I trust? You want me to give you a source of somebody that?
Like, give me a government part. The World Health Organization, the CDC, JAMA Medical Research, Johns Hopkins University, Harvard. Can you give me some idea? Because I don't want to give you sources and you say, those are untrustworthy.
I'm good with all of those.
Okay, you're good with all those? Okay, let's try the CDC.
I'm good with all of those except for the one you had. Hang on, you said one in the middle that I don't recognize
JAMA,
off the top of my head.
Okay.
So not that one, but Harvard, Johns Hopkins.
CDC?
Johns Hopkins, I recognize. World Health Organization, CDC, yeah.
Okay.
Yeah, and remember, I'm going to expect you to show me that old strain infections of COVID infections are more, that they're going to protect more against infection than updated vaccines are.
Yes, I will show you over a period of time. What I will show you is from the CDC putting a paper where they looked at millions of people over this period of time. That over that period of time that they did this research, that people that had a prior case of COVID were more well protected than people that were vaccinated. So this paper is from CDC, January 19th, 2022. It looked at, in California and New York, various populations of people. Right? It looked at 4 different groups. Those that were vaccinated and had a previous diagnosis of COVID, and those that were vaccinated without a previous case of COVID. Right? And then those that were unvaccinated with a previous case of COVID, and those that were unvaccinated with no previous case of COVID. You got it? Makes sense? You understand what I'm saying?
Yeah, I've read a lot of studies. This is, I would say, exactly how I would want you to run a comparative study on this kind of analysis.
Okay, so let's look what it
said. I haven't heard you mention any kind of variables accounting for variance, but which is
really
what I'm looking for here.
Right. Yeah. What I was doing was saying what the study was.
I'm just saying that I'm agreeing so far.
Gotcha.
Yeah, I'm just saying I'm with you so far, but this is still my holdout.
Okay, you can hold out, that's fine, and I'm willing for you to provide counter evidence. I'm absolutely fine with that. So let's look at California first. Vaccinated people with a previous case of COVID diagnosis, there were 960,000 people and change, and they looked at 3,471 cases. Unvaccinated with previous COVID diagnosis, there was 1.3 million and change they looked at, and there were 6,805 cases. In other words, if you had a previous case of COVID and were unvaccinated over the period of time of this, there was only 6,805 cases which were asymptomatic or more out of 1.3 million. That puts your chance of getting COVID over this time, even an asymptomatic case, of 0.4964%. If you force those people to get vaccinated on top of that, that lowers from a 0.49% chance of getting even an asymptomatic case of COVID to a 0.35. So the argument you're using to justify forcing these people with a previous infection to get vaccinated
Can you send me what you're looking at?
Yes, this paper is... You want me to put it in the Discord? I could do that.
Yeah, there's
put it in Tom's Discord.
Right?
Is that all right?
Yeah, that's fine.
Where do you want it? In the Discord?
Yeah, there's a VC text right above
VC
us.
text.
That's fine.
You go to page 3, you can see. You follow along with me.
Oh, it's in our. Oh,
You see it in the
Yeah,
VC
it's
text?
my Discord and VC text right above us.
yep.
So you can see that these numbers show, if you look at either California or New York, in both cases, those with a previous case of COVID were less likely to have even an asymptomatic case of COVID or to have a hospitalized case of COVID than those that were vaccinated without a previous infection. You agree?
It's still loading for me. So you're saying that this study says that if you have if you've been vaccinated and infected, you're more likely to get COVID and more likely to be hospitalized?
If what the first thing I'm saying is those with
Is that what
natural
you're saying?
immunity, those with a previous case of COVID were more protected over this study from the CDC that occurred, the time frame occurred during the time that Biden suggested his vaccine mandate. So the best available evidence that he would have had access to from his own CDC suggested those with natural immunity, those with a previous case of COVID, were less likely to contract and spread the disease than those that were vaccinated. So your argument and his argument that we should only force those that were unvaccinated, even those with a prior case that were more protected than those who were vaccinated, shows that this wasn't about science, it was about vindictiveness.
Well, first of all, I don't think that what you just said is true. That's a silly jump. But also, I don't see anything in here discuss what vaccines the people had gotten and what strain of COVID they were infected with.
So it would have been the strain that was
Which
the
is what my
numbers
holdout
were
was.
These numbers went from May 30th to November 20th, 2021. So at that point, it would have been the Delta variant?
This is the time they looked at the people. It doesn't. Wait. I'm looking right here. Let's see. Protected. Does it say when the people got infected?
It says that they looked cohort sizes and cohort-specific incident laboratory-confirmed COVID cases in California and New York and hospitalizations in California, May 30th through November 20th, 2021. I suppose if your argument is, well, maybe they were infected 2 years prior or something like that, it seems, I don't know what point you're trying to make. I think the best these studies are going to be able to do, because it would be near impossible to find the exact date of infection, would be to actually admit the date that they were recognizing this when the test came back as positive. So I don't understand why that would not be a preferred methodology.
Hang on, it's all loaded up and I can read it now.
Sure.
What page were you on?
Page 3, there's a table at the top of page 3.
Yep, I can see that. Let's see. Vaccinated, unvaccinated. Oh, this is comparing New York. Yeah. Okay, no previous diagnosis. Previous vaccine. The vaccinated people that had a previous diagnosis did better.
Did they? Yeah, they did do marginally better. That's true. Yeah, and?
Okay, that's what I said.
No, that's not what you said. We were talking
and you also didn't provide the thing that I had a holdout for.
So, again...
I said that if you're vaccinated and you had a previous diagnosis of COVID, that you would do better.
That's not what you said.
I never contested that.
What we were discussing was two different groups. Those that had a previous case of COVID and those that were vaccinated. And in those two cohorts, which group was more protected? And this data is quite striking, that it is the people that had the previous case of COVID that are less likely to contract and less likely, therefore, to spread, or less likely to have a serious case of COVID. So why should they be forced to be tested every week if they're more protected than the people that are vaccinated?
Because we don't have the information of when they were infected.
It's irrelevant. We don't necessarily...
I said that somebody who's vaccinated and somebody who's previously infected can have comparable immunity, but we don't know what strain they were previously infected with. And if it's not the one that's relevant to infecting people at that time, then that's not going to be a good metric of how safe they are. So this was my claim. This doesn't disprove that at all.
So your argument would be, then you have to assume, because this study doesn't say, and this was around the time of, there was the original, like the Alpha variant, then the Delta variant, then we had the Omicron variant, right? So this is looking at things, you would agree that this period in 2021 would have been the Delta variant, correct? Yes?
I think so, yeah.
Okay, so given that, this study doesn't say...
If not Omicron, if not Delta, Omicron, it's one of those two.
Okay,
sure.
Nonetheless, this paper doesn't specify when the previous case of infection was. So I think it would intuit that the best possible example is it wasn't looking specifically at were they previously infected with Alpha, Delta, or Omicron, correct?
Yeah, that was my holdout.
Okay, so even then,
For the study,
so now we could assume that the previous cases of COVID could have been any one of those three, and still without just because your argument would make sense if it's like, well, those that had a previous alpha infection would have been less protected than those that had the most recent vaccine. But no, this says that even taking that into account, if we're looking at alpha, delta, and Omicron in previous infection, as a whole, people that were previously infected are more protected than people that are vaccinated. Even though we are on our second or third variant. Still, then, going almost into January of 2022, people with natural immunity were more protected. My question to you, real quick, my question to you remains the same. Why then, if this is really about science and protecting people, shouldn't we have the group of people that are less protected, those that were vaccinated but didn't have a previous case of COVID, why shouldn't they have to be tested every week?
I said that they're comparable, and if a person who is unvaccinated and who had contracted COVID, if it is of the relevant variant, that it is comparable to somebody who got an updated vaccine. I said that. And sure, if that was the case, that I would be fine with them not getting tested.
Okay, but it seems odd that
at
both
least
you
for
and more...
at least for a period of time.
Okay, but the problem I have with
this is what I said the whole time. I didn't change what I said.
But let me finish. The problem I have with you and the Biden administration is that's not the nuanced position you took. The position you took was you supported the mandate. And the mandate was a one-size-fits-all approach for everyone. It didn't say, oh, well, we've looked at the science, and it says that people that have had a previous case of COVID, that they're actually as protected, if not more, and therefore they don't fall into this group. No, that's not what occurred. And we know that this would have included millions upon millions of people at this time, that you admitted that this would have been odious and burdensome to force them to do these things. And again, you already admitted at the outset of this debate that it should be on you and on the people that want to take rights away from people to prove it. And instead what you've done is you put the burden as the opposite. You said, we'll be authoritarian.
I agreed when you didn't say prove it. When you said prove it, you said to articulate why. And I agreed to that. I didn't agree to prove it.
Okay, well, do you have
articulate why.
Okay, so at the time you supported the vaccine mandates, and clearly Biden did, right? And this is the best available evidence we had at the time. And it shows quite clearly that people that had a previous case of COVID are more protected than the vaccinated. So why shouldn't they be criticized for being unduly authoritarian?
I addressed this.
What's that? You didn't.
Because the people that had a prior case of COVID going into work do not have a way to show which variant that they had when they were previously infected.
You've conceded that
So because we don't have that, yes, I am in favor of people either getting tested or getting the vaccine.
You've conceded that
if you could prove that you had the latest variant.
You've conceded that this
If you want to say that this study said...
I get the need to keep interrupting. I get that, right? You've conceded that this study is from the CDC. That's one that you would trust. It seems to be what I could find is the most comprehensive at the time that these vaccine mandates were being suggested. And when they're talking about previous cases of COVID being more protecting, they're not differentiating from variants. They're saying any previous infection, not just a previous infection of Delta, not just a previous infection from Omicron. They're saying any previous infection. So you've conceded all of that. So what we have here is the best study we have, the most comprehensive study that looked at millions of people at the time that you and the Biden administration was wanting to force vaccine mandates, suggesting that actually those that have any sort of previous infection are more protected than those that are vaccinated. Now, this is particularly striking because you have bragged that you tried, it's particularly in the first 2 years, to read everything possible. How did you miss the CDC paper?
So I've been actually reading this. Here's the thing. I've read a lot of stuff, so I might not remember each one individually, but I'm reading what you sent me, and I think that this is very interesting because this was during Delta, and it does seem to be the case that we didn't have updated Delta vaccines yet.
And?
So this is how well the previous. So this is showing how well the previous vaccines protected people against a variant that it wasn't designed for, versus people who have been previously infected.
When did the Delta variant begin?
Past the fourth page.
When did the Delta variant begin?
Well, I guess it wouldn't matter. According to this study, this is looking at the time when the Delta variant was predominant. So, based on what you were saying, it seems like what I said would hold through. Did you read this?
Yes, I absolutely read it. When did the Delta variant begin? Now, I don't claim to have read everything on COVID like you did, particularly in those first 2 years. So these would be.
I've already agreed to you. Oh, wait, I've already agreed to you, saying sure, this is when Delta was taking place.
Okay, when did the variant begin? That's my question. When did the variant begin? It's a simple question. When did it begin? Do you have just a ball? I'm not asking for a specific date, like a ballpark. It matters because you're trying to differentiate here. You're saying that we can't trust this study that we have because
I was going off of what this study says.
Okay.
So it wouldn't matter when it started.
Sure. Next question. When did Delta vaccines become good? Can you tell me that?
I'm looking at the date when this was I'm trying to look at when this study took place. You said it was from.
It says at the. Do you see where the table's at? Do you see where the table's at?
That's when it was
on page 3, the very top of it, it says Table 1.
Oh.
May 30th through November 20th, 2021.
November. Okay, yeah. This looks like it's taking place. Yeah, when Delta was by and large the most prominent variant.
When do you know when Delta began? Just for the sake of me and the audience. When did the Delta variant begin?
I just told you.
When?
I just said it. October 5th.
October. So the Delta variant started October 5th, 2021.
2020 in India, but by November 2021, it was the prominent strain in the United States. It wasn't prominent then, but by a year and a month later, it was the prominent strain in the world.
So when would that?
And
I'm
like
just
95% of the
I'm not very good at math. So what month would that be that it was the prominent? It became the prominent strain in the world.
November of 2021.
Okay, so this study again encompasses infections between May 30th and November 20th, 2021. That would be immediately preceding when Delta became the strongest variant. So your criticism's unwarranted.
I was still looking at the data that's during incident cases.
I'm trying to steal me in your.
You have to come up with something that shows that the Delta variant, even if there was a different vaccine, would still have a better outcome.
Right. So I'm trying to steal me in your position. Your position seems to be we can't really look at this data because the problem is this data is going to say previous infections are better than the vaccine because this was during Delta and we didn't have a strong Delta vaccine yet. And yet it seems, according to what you just told me, that Delta started to become the dominant variant in November 2021, and yet this study encompasses May until November 2021. So that would literally mean that I don't understand why your argument would discredit this data.
We didn't have an updated vaccine until post-Delta, so we were still operating off the very first vaccine. We were not operating off the first variant of COVID when this study took place.
But you just said that's not true. You said that Delta didn't become the prominent one until November 2021. Isn't that what you said?
Do you think we went from the original? Do you think we went from the original to Delta?
Can you tell me which ones we went to in between? Yeah, that is what I think. That's what all the literature suggests. There was the Alpha, then there was Delta, then there was Omicron. Yeah.
No, we had a lot of subvariants.
Okay, can you give me some of those subvariants that were prolific? Go ahead. Did we have individual vaccines for all those subvariants?
No, we were trying to catch up. There was Alpha, there was Beta in between.
Okay.
And that the most prominent ones that we've had in the United States were Alpha, Beta, Delta, and Omicron. But there were other ones that did gain footholds in a lot of states in between.
So let me.
There was a lot of state-specific
let me explain why your argument
Most
doesn't
spreading
make sense here, because you're saying, okay, sure, this CDC data does say those with the previous case of COVID were more protected than those that were vaccinated. But the reason that shouldn't apply is because we didn't have the good updated vaccine to the new variant. But then you've acknowledged, well, actually, the new variant didn't become prominent until after the time that this study took place. But you say there were these minor variants.
Well, no,
Let me finish real quick. You say there were these minor variants,
not true either.
but then you also admit that there weren't special vaccines for those minor variants. So it would still say that at the time that you and the Biden administration pushed the vaccine mandate, the truth is you knew, or at least you should have if you were as well read as you suggested, and the government knew that actually the people with the previous case of COVID were more protected than those that were vaccinated. You knew that and the government knew that, and still you pushed for an authoritarian position that punished people that were more protected than those that were vaccinated. And you can't give a reason why. I'm ready to move on to the next stage. This is just the tip of the iceberg of why it's bad.
Okay, so there's several things that are happening in this conversation here. One of them is that Delta was the prominent strain or part of this study. But also, the way that I've contested you is by saying that I don't know when the person got sick with COVID. And I don't know, but if I know if they have the most updated vaccine, that they're going to have an acceptable level of protection. If somebody got infected with an old strain of COVID, and they say, I don't need to get vaccinated and I don't need to test because I have had a previous diagnosis of COVID, that does not tell me the information that I need to assess how much their
so we
natural
are looping
immunity
at this
is going
point.
to be.
Razi, in order for you to do that, though, you would have to show that, one, that there was a different vaccine that was going to be more effective. And so you would have to show that it was, because he's saying from the data that we have, we would have to assume that this is going to be the data going forward, and you would have to show something different. And so that's the only way that we could move on.
Yeah, and I would be willing to, if you have a further CDC study or any study that you'd like to bring forth that showed that vaccinated immunity was better than natural immunity, I'm willing to look at it. But it doesn't change the fact that during the time of this mandate that
sure, I was just focused on you weren't addressing those things. So in the study that you sent me, I was just focused on those other things. In what you showed me, we can see that the rate of let's see, where is it? Vaccinated, no previous COVID diagnosis they're all comparable here.
That's right.
At the very bottom, there's a chart here.
Yeah.
And like I said too, it's comparable. If these people were all getting infected with the same ones, that's fine. Like I said, if you are being infected with, if your infection is going to be comparable to what it would be if you were vaccinated, which can be the case.
Drazi, he's saying that you supported the vaccine mandate, so you can have that position now. He's saying that at the time you
because it
the
can't
mandate,
be.
So he would want you to concede that you shouldn't have supported the mandate.
If they could show that their infection was from
I think you're looping. If I can move it forward, I think you're looping. I don't think
that would be on you to show that it was
right. I don't think this is responsive to the data I'm showing that shows that all previous infections seem to make you more protected.
You can't.
Okay, so I would like to move forward if you don't mind. The second thing I would like to say on this data specifically is even those that
you can see that the study doesn't show that.
Are you going to get numbers that would show that there's a different outcome from other vaccines, or do you want to move forward?
It's up to you, Elderdrazi. If you want to bring forward a new study
from a more updated vaccine,
yes. Would you show that there's different outcomes from a more updated vaccines? Yes.
What you would need to do is provide a study that shows that at some point when we got a new vaccine, that the defense from a new vaccine was superior than the defense from natural immunity. And even that's not like what you
any strain of COVID.
Yeah, what I mean, sure, you could bring up any and we could look at it, right? But what I'm saying is even that doesn't answer the question. You're talking about something that's irrelevant. You keep saying, well, this is incumbent on specific strains that they had, and we don't know when their previous case of infection. But again, you've already conceded that this study is looking at all previous infections. So that would encompass Delta, that would encompass the beta ones that you're talking about, that would encompass Alpha. And taken as a whole, that group is still more protected than those that were vaccinated. And you just keep looping saying, but we don't know when they were infected. I'd like to move forward if you don't mind, but if you want to bring forward another study, by By the way, this is why I didn't want 12 subtopics. I think you can see I have at least 3 more hours of stuff to talk about on this topic specifically, which I know I won't get to all of it, but that's why I thought it would be best to hyper-focus on a couple of key things. Would you like to move forward, or do you want to...
So, Drazi, we have to know if you want to get like something that would actually show that that there's going to be different outcomes for updated vaccines, or are you wanting to where they're not comparable whatsoever, or do you want to move to another part of this topic?
I was still reading through this study, which
that's what I'm going to do. Get to more parts of it, if you don't mind. That's what I would like to do.
Stuff that's not.
Okay, I'm going to move forward. That's cool then. The next thing to say that's worthwhile in this is, remember, we would say that the government shouldn't have the right to imply these sort of restrictions against people's bodily autonomy unless there is a huge reason to do so. Like, for example, would you agree with this? You wouldn't support vaccine mandates if it would save one life. Would you agree with that? Are we having a debate, or what's happening here?
Wait. I don't. Wait. I don't think that whether or not somebody's going to die is the metric that is the only metric I'm going to care about.
Okay, that's fair. So would you say, though, that there has to be some sort of threshold? For example, would you force people to take a drug, vaccine or otherwise, if it could prevent 5 bad outcomes? Or would you say, no, clearly with a number that small, we wouldn't enforce against people's bodily autonomy. It'd have to be something of a more magnanimous number.
Correct. There's some arbitrary number that when we see it, we can understand that there's going to be a risk that's posed prior to it becoming a large problem.
And that's fair. That's totally fair. And I'm not going to hold you to, well, what exactly is that number? I get it. We're just making a simple argument that it's not just to protect one life we force people. And I assume that you would agree with that. So the problem I have here is this population of people specifically, those that had a previous infection. If we look at California, I believe the numbers they looked at was 1.3 million. You know how many people ended up getting COVID, even asymptomatic? 6,000 out of 1.3 million. Why should those people be forced to be vaccinated if that number is that small? That's not just deaths, that's any infection.
I'm sorry. Can you repeat the argument?
Yes.
I just want to make sure I'm understanding.
You seem to make an argument that there has to be a certain threshold. It doesn't just imply death. I say you wanted to force people with a previous case of COVID to be vaccinated, right, or tested. When that number is, there were only, out of 1.3 million, 6,000 of them that had any COVID infection, even asymptomatic. That's such a low percentage. Why would we take away their bodily autonomy? It seems to not meet the threshold arguments that you would be suggested are necessary.
I do think that that's this is only the one subsect of people.
Those are the people. Those are the subsect. But the argument I'm making is that you supported a mandate.
Why would I want them to get vaccinated? Because they would still.
No.
Okay, so let me put it this way. Why would I want? I'm going to answer your question. And you can correct me if I'm wrong. Why would I want people who have previous immunity from a previous have immunity from a previous infection to get vaccinated?
That's not the question.
If they already have
that's not the question.
Some protection.
That's not the question.
Okay.
The question was, why would you force them?
I was going to say if I'm not, they can get tested.
Okay, why would you take away their autonomy to force them to get vaccinated or force them to get tested when the number is so low?
I don't think that we ever see requirements for vaccinations before this as stripping away somebody's autonomy. Are we stripping away the autonomy of parents by making them get their kids vaccinated before?
Yes, forcing someone to take a drug would be stripping away of their autonomy. If you say, for example, we force a polio vaccine, I may disagree or agree, but it's definitely coercion. The question is the threshold for why we do that significant enough? Well, we could say, well, if they didn't, then polio would have infected 6,000 of them, or something to that effect. What I'm saying is you had this threshold argument, which you've conceded that, of course, we wouldn't force people to take some sort of drug, particularly a new experimental drug, if there was a very low threshold of how many people were being affected. I'm not a math whiz, but 6,000 out of nearly 1.4 billion people, what's that percentage? Tom, are you good at math? You got a calculator in front of you?
That's not the correct number.
Why wouldn't it be?
You're not good at math.
You're right. I'm not good at math. You tell me what that percentage is.
People.
I'm sorry?
Based on the numbers you just said 1.4 billion.
Million,
not
with an M. It's the specific number, if you'd like, just so we don't accuse me. The specific number is 1,370,782 people that were unvaccinated but had a previous COVID infection. Of that, 6,805 had a COVID incident, which would include even asymptomatic infections. So what's 6,805? What percentage of that is of 1,370,782
wait a minute.
people? Wait a minute, what? I'm asking...
Wait. That's when you're looking at Yeah, wait a minute, what? I'm trying to tell you.
Okay.
That number's in California.
Yes.
And if you look at other states, like they looked at
New York?
And they looked at New York, that number goes up. That's not like a stable number that's going to apply
Sure,
across the board.
let's look at New York. They looked at 500, in that same population, unvaccinated people with a previous COVID infection. They looked at 527,100.
Less than half.
Please, let me finish. They looked at 527,140 people, and of those, 3,250 ended up with COVID. Again, a remarkably small percentage. Remarkably small. You're right. This study looked at 2 states and came up with almost identical numbers at both. Those with previous cases of COVID were more protected than those that were vaccinated, and their chances of getting COVID, even asymptomatic, was remarkably low. Like, what is that percentage? Less than 1%?
Okay. So, I'm curious, what do you think that the government should do about it then? Should they suggest that people get infected then to protect themselves?
No, I didn't say that.
And so that we have people like having COVID parties so they can spread it to people. Well, then the thing that we would try to get people to do would be to get vaccinated to protect them. You can't encourage people to get sick in order so that they be protected. It's kind of a catch-22 there.
That has
The one
nothing
thing
to do.
that you
The
can
question.
do to
The
reduce
question.
these numbers is
The question doesn't identify what we're talking about specifically. We're talking about millions upon millions of people that already had a COVID infection. What should happen with those people? You say those people should be forced to be vaccinated or forced to be tested every week. I say that's absurd because those people are more protected than those that are vaccinated. And we haven't even got to the third part of this, was that forcing them to get vaccinated actually harmed them. This is before we even talk about the harm that could come with vaccine. We're just talking right now, should the government have the right to tell people that have less than a percentage point chance of getting infected with something that they should be forced to take some sort of drug? I say no. Would you like to move on to part 3? The outcomes for these people that are forced to take the vaccine on top of having a previous case? Would you like to move on to that?
I would say that if you look at the number, I would say you see a stark decrease if people who were infected had gotten vaccinated.
Okay, so let's talk. What do you mean by that? So you're saying people that had a previous case of COVID, if they get a vaccine on top of that, that offers them superior protection?
Yeah, based on the study you sent.
Okay, you want to get to the numbers?
Yeah, absolutely.
No problem. Totally willing to talk about it. You're technically right. Let's talk about the numbers. If we go back to the same group, the vaccinated with previous COVID are 968,167 people, and they looked at, there were 273 cases that required hospitalization. The unvaccinated with the previous case of COVID, they looked at 1.37 million and change, and there were 378 amount of cases. So group 1 is people that had a previous COVID vaccine, or previous COVID case and got vaccinated. And group 2 is people that didn't get vaccinated.
How about we just use percentages to make things a little bit more clear?
Because I don't have the percentages. I didn't do the
when you
percentages.
use raw numbers here, it's going to be very. It says it right next to them.
No, those percentages aren't. Those aren't the specific percentages. Those are different. The indices or whatever they're using are different. Nonetheless, I'll finish this. I think I do the percentages here. I wrote this down years ago because I was looking. Let me finish, and then you can see if you think that these percentages are good or not. Yes, you read that right. Over 1.3 million people with a previous case of COVID in California, according to the CDC's own numbers. Only 378 people had to be hospitalized with COVID. And that's the group that we're going to force vaccines. What's even more astonishing, that this means that over the course of this study, those that weren't vaccinated and had a previous case had a 0.0276 chance of being hospitalized with COVID. And if you force those people to get vaccinated, guess what? The
Why are you
number,
switching it to
let me
hospitalized?
finish
You're
real
switching
quick.
it.
Let me finish real quick. You wanted the percentages. I'm happy to give them to you. I'll repeat that sentence again so you could hear. What's even more astonishing is over the course of, please let me finish if you want the rest of the debate.
There's a lag on your end, and so even when you do start talking, it is like 3 seconds behind for us, and so vice versa. So try to keep it. Wait for the pauses.
So I'll finish. It's only like 3 more sentences.
Okay.
What's even more astonishing is that this means over the course of this study, those that were unvaccinated and had a previous COVID infection had a 0.0276 chance of being hospitalized with COVID. And if you forced them to get vaccinated, they had a 0.0282% chance of being hospitalized. Yes, you read that right. The chances of being hospitalized with COVID over the course of this study increased if you forced people with a previous case of COVID to get vaccinated. How can you justify that?
So you're switching from... Well, I don't have to justify because that's not what we were talking about. We were talking about people getting infected. I care about people getting infected and spreading to other people. We talk about people that are hospitalized, and I don't know why. Why do we care about that?
Well, I think we would care about... Do you care how many people each year get the common cold?
Not in the context of what we're talking about, no. Just like I don't care how many people are hospitalized when we're talking about how many people are going to contract it and then be able to go out and spread it to other people.
The reason that we are concerned about COVID in the first place was because of the people that had terrible outcomes. No one really gives a shit how many people had a asymptomatic case of COVID. Now, we already went through that the chances of spreading COVID if you had a previous infection are remarkably low, less than a percentage point. We already went through how that was better than people that were vaccinated. So forcing these people seems to have almost no benefit whatsoever in preventing even asymptomatic cases of COVID. But what we do see is it makes it more likely for those people to have more severe cases of COVID. So why should you tell how do you explain to someone like, hey man, I think you should have to take this vaccine, even though you have almost no chance of contracting COVID, even though you have almost no chance of spreading it, and even though you're more protected than the vaccinated person, but we should force you to take this knowing that it will increase your chances of having a severe case of COVID. How could you rationalize that?
Okay. So it's not what we were talking about. You've switched to this now. When I pointed out that people have better immunity who have gotten it, you've switched to hospitalizations. The entire time we've been talking about people getting infected. And as soon as I bring up a point that would suggest that having COVID and still getting a vaccine would be better, you want to switch to hospitalizations. If you want to talk about hospitalizations, we could talk about hospitalizations, but I'm not going to let you run away from this point to talk about hospitalizations.
We weren't running away from a point. You have literally
argument.
We're not running away from a point. You've literally stalled on every point that I've brought up.
Okay, then
every single one. So, for example, the first point I had was the first point I had was that people that had a previous case of COVID.
Wait, instead of reiterating your first point, you could just respond to the point that I made that you talked about hospitalizations instead of.
I will respond to your points if you like. Your point that you're making now, you tell me if I'm wrong, I'll steel man your position, is that I, quote, ran away from your point of what we had been talking about previously and now ran away to hospitalizations. Is that your argument?
Yeah, I'm asking you to address the fact that people that got vaccinated who had a previous case are significantly more protected.
And do you think it would be incumbent on me in answering that to discuss why I'm not running away from the point and have already addressed that? Do you think that would be a legitimate way for me to respond?
You could just, if you think you've already responded, then please just repeat your response and then we can move on.
Which is exactly what I was doing, and then you interrupted me and told me that I should have to respond when that was exactly what I was doing. So will you give me the courtesy of giving the response that you claim you want to hear?
By all means.
Okay, the point I made this threshold argument, which you conceded to, that said that we wouldn't say just for a small amount of outcomes that we would force something upon someone. And I made the point, which was uncontested, that these people have such a low chance of having any COVID incident, even asymptomatic, that it seems absurd when there's less than a percentage point of getting it over the course of this study that we would have forced this upon them, particularly when they were more protected than the people that had the vaccine. So now we've moved on to the point of, okay, since there's no offensive reason to make them get this because it's such a small, less than a percentage that it would have some effect on. Now we could look at offensive reasons to not get it. In other words, harm that would be caused to them. The first area of harm that I'm isolating is because you've already lost the argument that there's no real reason, no substantial reason to prevent COVID to force these people to get it, because the protection they get is so minuscule and the incidence that they have anyways is so minuscule that it wouldn't be worth it. Why would we force this upon them if it causes severe effects, such as a more severe case of COVID? Can you answer that?
Yeah, well, one, I don't think that it's an insignificant amount when it looks like the rate's cut by like 33%.
I don't believe
also,
that's the case.
This study doesn't account for people that had this study says that it doesn't account for people that have updated vaccines or booster shots, additional or booster shots.
Again, so let's look.
Yeah, it doesn't account for that.
So then we'll go back to this argument if you like, which
So
I
some
thought
of these
was moved
people
on. So we'll go back to this argument if you like.
Some of the vaccinated people can have heavily waned. So yeah, some of the people can have heavily waned immunity responses as well.
So we'll go back,
which the study acknowledges.
So we'll go back, right, to the numbers. So first off, we've acknowledged that out of a population of 1.37 million that were looked at, there were only 6,800 cases of COVID. I believe someone in my chat suggested that that would be like 0.49%, something to that effect. Does that sound about right? Well, so
Can you give me the numbers?
I don't have a calculator. If someone wants to put this in, we can get the percentage. Right?
That's why I just said, can you give me the numbers again?
1,370,782 of those 6,805 cases. That's basically 0.5%, right? 0.49? 0.4964, correct?
It looks like when we're comparing them side by side here, the people that got infected were from the unvaccinated with a previous diagnosis were 5% and 6.2% respectively.
I think that is absolute horseshit. I think that you've made some sort of mistake in your math.
I'm looking at this. I'm reading it off the study.
Again, you're telling me that 6,805 people out of a population of 1.37 million and change is 6%? That's ludicrous. Like, I'm not very good at math. I can see that's a joke, right?
That's what it says on here.
Okay, well, the number I came up with was that's 0.4964%. That's less than 0.5%. I guess we'll leave it up to the audience and the moderator to determine whose math's correct in this. I think yours is obviously laughably incorrect. So the fact that we would force this on a population of people that it's only a 0.49% chance of even getting an asymptomatic case of COVID seems ludicrous. Doesn't seem to cross this threshold argument of when we would force something upon people. But let's say we do force them, which is what you want to suggest. You say, but that massively increases their protection. Oh, you have something to say?
Actually, so as far as people being hospitalized, the numbers are equal from vaccinated and previous COVID diagnosis here.
Are you moving on to another subject now? You asked me to go back here, so I go back here, and now you're jumping forward to the topic you said that I was running to?
I just reading the numbers off of what you were citing.
Okay, so then I'll finish my point. So we could all. I'll finish
as I read it.
I'll finish my point. My point was that this is already a laughably low number of people that wouldn't meet the threshold to force away their bodily autonomy. But if we do, which you suggested, and we look at the percentage of people that had a previous case of COVID and were vaccinated, we can see that their chances of getting COVID was 0.3585. That's right. That means that by forcing this population of people that already had a laughably low 0.49% chance of getting any case of COVID, if you force them to take the vaccine, that does lower to 0.35. So that means without looking at any of the side effects, that you're saying, no, we should force these people into this action because it takes them from a laughably low, less than half a percentage point.
I didn't say that.
Or test them, whatever. Okay.
Or get tested.
Okay. That's what it's worth. That's what you're talking about. That difference between 4.49 to 0.35. So you're saying, yep, that's worth it.
Do you understand that when you go from 0.49 to 0.35, that this is actually a pretty steep change?
How many people?
It doesn't seem like that because these are both small numbers.
How many people would that be?
Well, as you scale up, Well, do we want to scale that up to the rest of the United States?
Well, let's get
these percentages.
Sure. Scale away.
Okay.
So I just want to be clear.
So
You would be for forcing anyone for an infection disease that less than half a percentage of people could get. You would be for forcing them to get tested every week or to take an experimental drug, even if it led to negative outcomes, increase their own negative outcomes. You would be for that. I just want to be clear, because it seemed previously you seemed to say, no, it has to meet some sort of threshold. So your threshold would be less than half a percentage point.
Yeah, if you less than half a percentage point of the population of the United States is still 132,000 people.
Okay, so you're saying that yes, any disease, no matter, you would force them to take some sort of drug, even if it only slightly increased the chances of them not getting that illness, and it gave them more significant individual effects.
This is only comparing against people that already had gotten it.
It's comparing people that had a previous case of COVID and weren't vaccinated to those that had a previous case of COVID and were vaccinated.
I have said, if somebody had a relevant case of COVID, then I would be fine with them going to work the same as vaccinated people.
Okay,
but
so
since we don't have a metric to do that,
that's not true. This metric gives that metric, which is people that had a previous documented case.
Okay, you got sick with a previous case of COVID and you want to go to work and they go, hey, have you been vaccinated? You go, no, I was sick with COVID for... Okay, can you give me the paperwork to show which variant you had so that we know that like you have up-to-date...
Why does the variant matter? Again, this study is very clear, as you've already conceded, that it's not just like... We're looping. We keep going back to the same points. And again, the question I have for you is, you didn't have this caveat at the beginning, and you can't claim ignorance, because you claimed that you, for at least 2 years, tried to read everything. This is a CDC paper. This isn't some obscure... This is one of the biggest papers that came out. How were you unaware of this information? It seemed like your impulse was just to be authoritarian. And now you're hedging and backtracking.
I don't think that it's authoritarian to require people to get vaccinated or tested. You keep on trying to hammer down that I said, yeah, you must get vaccinated, or get tested.
You're being coercive to people if you're forcing them to get tested every week or lose their job. That is authoritarian. Now, you ready to move on to the next part that you said that I was jumping to? Did I sufficiently handle this part for you? All right, next part. You concede that these numbers show that although you have a very small chance if you have a previous infection of being hospitalized, 0.0276, that actually increases to 0.0282 of being hospitalized once you're vaccinated. So there is an increase in your chance to be hospitalized if you've had a previous case of COVID and you get vaccinated, according to this study. Why should we force that upon them? Why do you think, hell, even take force out of it, why should we even suggest it to these people?
The results suggest that vaccination protects against COVID-19 and related hospitalizations, then surviving a previous infection protects against reinfection. Importantly, yeah, I don't think the study says that.
You don't think it says that? Okay, so let's go through the study. We'll
go
through the numbers if that's. We'll go through the numbers if that's what you would like. So what we're looking at here.
Wait, if we're going to trust the study, can we trust the people running the study?
I'm taking a study. I asked you what organizations you would trust because I knew that you hadn't read this, and I knew that you would eventually default to we can't trust.
That's not my question. I'm saying.
Do you trust this study? Do you trust the?
Can we trust the people that are running?
Do you trust this study?
Can I ask my question?
Yeah, you could ask it.
Drazi is saying he trusts
the
study and he thinks that we should trust the outcomes and what it is that they're putting in the study. So what part, Drazi, in the study are you pointing at that you think he should trust? What is it?
It says in the study, in the discussion part of the study, that people that are vaccinated across the entire study, persons with vaccine and infection-derived immunity have much lower rates of hospitalization compared to the unvaccinated persons.
Well, they're wrong, aren't they? Because
so it would seem to be the case.
Well, what I trust is the data. Their interpretation of the data, I don't. What I trust is the data. I have no reason to think that this data is inaccurate. What I don't care is what their opinions in reading the data are. If we could look at the data ourselves. So, for example, I could cite a bunch of data on anything from housing to military development, whatever, and if my conclusion drawn is opposite of what the data suggests, then no, I wouldn't trust my outcome. That doesn't mean that the data itself... So if you're saying that they're directly saying, actually your chance of getting hospitalized was lower, then surely the data they used, which we could look at right now, will show that. Let's look at the numbers and see if that's accurate, shall we?
What I'm saying is that I'm going to trust the people that ran the study to interpret the data more than I'm going to trust you.
So you don't trust your or my ability to look at these numbers and determine whether or not they are accurate or not. That's what you're suggesting.
Compared to people that are running the study at the CDC, correct. I'm gonna go with
okay, so I just want to say, if they said, for example, let's make the numbers nice and round. If they said, for example, 10,000 people that were vaccinated got COVID. There was 100,000 people got vaccinated, 10,000 of them got COVID. And there was 100,000 people that weren't vaccinated, and only 10 got COVID. And they come across at the end and say, and therefore we look at the data and say that if you get vaccinated, you're more protected. And I said, but their numbers suggest completely the opposite. You would say, you can't look at the numbers, Rob. We have to trust what they said at the bottom. Why can't we look at the numbers and see if the numbers back up what they're saying or what you're suggesting? Why can't we do that? If I'm reading the numbers inaccurately, then surely you'll be able to tell me that's the case, correct?
What I'm contesting is that you and I are, neither of us are as educated to interpret the numbers as the people that are running the study. And I don't understand why that I would think that you or I would think that we know better than the people who are running the study. Unless it's the suggestion that the people that are running the study put these numbers out there for everybody to see, knowing we could simply just call them on it, and then instead it did that and then said, yeah, but actually we're concluding the opposite.
No, I would say what they did was they knew that people like you that were just blindly following anything the government said would give them a pass even if the data didn't back up what their recommendations are, which is exactly what you're doing right now.
So correct.
You're literally making the argument that no, how could an average person look at numbers and percentages? They can't do that. Only someone that works for the CDC would be able to do that. And the mere fact that you're making that argument right now proves. You want to go to the data? You want to look at the numbers?
You're sneaking in a concession to what I said then. So what you're saying is that these people decided to maliciously misrepresent their data to try to trick people.
I don't know. I think what they most likely did was the point that they were trying to make is telling people they should get vaccinated. And the efficacy that they're putting for the most here is looking at the people that didn't have a previous case of COVID and weren't vaccinated and seeing that they had worse outcomes than people that were vaccinated. And so they're putting this study out there as part of a full-throated effort from our government to try to convince people to go out and get vaccinated. It doesn't help them.
How would that not be a conspiracy?
Okay, maybe it is a conspiracy, and I don't give a shit. Why they say what they say, if they say what you're saying they say, is irrelevant to actually looking at the data. You want me to... I want you to explain to me... I want you to explain to me if you're right, that they're saying that actually your hospitalizations in places like California went down if you had a previous infection and were vaccinated, and I can show you that the very numbers they use don't show that, then I want you to explain to me why they said that.
You want to try that one more time? You said a lot of stuff.
Okay, I'll go back and we'll just read the numbers. We'll just read the numbers.
I'll
go back and read the numbers, and we'll leave the audience.
Hold on. So maybe I missed something. It sounds like we're using hospitalizations to connect this to infected people instead of just like infected people being infected people. And so I think what Drazi was saying is that they say that the infected people goes down while hospitalizations may go up because that type of variant might be more serious. That when we read what their analysis says, that it would say that the amount of infected people are still going down.
That may be. I didn't hear exactly what he was reading. I'm telling you that this portion that I was reading, where I've gone through the numbers, shows that actually your chance of being hospitalized marginally increased when you were vaccinated and had a previous case of COVID. When someone with a previous case of COVID gets vaccinated. I don't know if Drazi... It does, as I've conceded, does seem to suggest that you go from a... let's see. In California, you went from a 0.4964 chance if you had a previous case of getting even an asymptomatic case of COVID. And if you got vaccinated on top of that, that did slightly lower to a 0.3585. However, those same numbers, those same groups, if we look at the hospitalization, slightly went up. So the vaccinated people with a previous COVID diagnosis of 968,167, there were only 273 cases of hospitalization. However, in the population of the unvaccinated with a previous case of COVID, they were looked at 1.37 million and change, and there were 378 cases requiring hospitalization. That means of the people that weren't vaccinated and got COVID, you had a 0.027 chance of being hospitalized. But once those people became vaccinated, in the California numbers of this study, it went up to a 0.282.
Okay, so, but we are at the hour, so real quick, Drazi, earlier he asked you, if there's a 1% change in this, is this enough for you to actually care? You said that you wanted to run the numbers and know what this was proportionality to the United States, but you never came back with a number and told us whether or not that actually made a drastic enough difference to where you would actually care about that number. And that seems to be your sticking point in this entire thing, no?
Yeah, so what... I would say that, yeah, the 1% is significant when we're going from numbers that are less than 5 to a maximum down to 0. 1% is extremely significant. I understand when numbers get this big and we're working with percentages, it makes it really hard to ascertain the difference here. But we're talking about a 1% difference can be, in this instance, the change was about 33%-ish.
I didn't even
so that's a pretty significant difference. And when you scale it up,
Wait, that would be
with a lot of really big numbers.
What did you just say? It'd be a 33% difference?
On some of these here, like when I looked at the unvaccinated and vaccinated in New York, and the cumulative instances of people getting COVID, there was a 1.3% difference here. Now, it doesn't sound like a lot, but when the highest number that we're comparing here is 6.2%, let's see.
The New York numbers are not much.
Or 1.3%, pretty big.
The New York numbers, as we already went through, the chances of getting, like, I want to get to this part real quick, and then we can move on to lockdowns if you want. I have a bunch of studies that talk, studies such as a MedX study, JAMA Network study, etc., that talk about your chance of getting a moderate to severe, or one moderate to severe side effect with each vaccine is reported as high as 56%. Now, it's true that many of those side effects are things like swelling, difficulty breathing, things that we wouldn't consider terrible. But the fact that you're talking about already such a low percentage chance of you getting COVID, already such a low percentage chance of you spreading it, and then forcing you to take the vaccine, only lowering that a slight amount. But to do that, there's a 56% chance that you have a moderate to severe side effect, seems ludicrous. However, the worst of all of these are, according to...
That's super bad faith.
Why is that bad faith?
You already admitted that some of them are like itching and swelling. When I got my COVID shot, I have an itchy arm still.
So what? The vast majority of COVID cases weren't serious.
I got one last week and my arm still itches.
The vast majority of COVID cases weren't serious. So? Why would you force someone to take something that you know will cause them an adverse negative effect for something they have almost no chance of contracting or having a serious case of? But if you prefer, we could go to the most...
My brain's still shorting out from your response.
Right, last thing I'll say... Right?
I'm still trying to take in the response that you just gave me when I asked about... When you're citing the 56%, you're admitting that it includes a lot of side effects that don't fucking matter at all.
Right, when you're citing the 0.1... When you're citing the...
But then you're trying to... Hang on. You're trying to group that in with severe side effects?
Yes.
That could seriously impact somebody's life?
Yes.
That's bullshit.
That's not bullshit. What you're trying to do...
You're misrepresenting the harm.
So what you're doing is misrepresenting the harm. So previously when we talked about the already increased...
If you actually care about side effects...
Please let me finish. So what you're doing is actually misrepresenting the COVID numbers, because what you're doing is saying the already less than half a percentage point of getting COVID, which of the vast majority of those weren't serious cases, many of them were asymptomatic. But if you could lower that 0.13%, you're like, well, if we take that out to the population of the country, that's a huge amount of number. Yes, and a huge amount of number is that less than like 3% of those cases would be significant. So in that sense that, yes, if you're like, of the side effects, the moderate to severe side effects, the vast majority of them, say 80% of them, aren't things that are that long lasting. Doesn't matter, there's still adverse side effects, and the vast majority, say 80% if not more of COVID cases, were also things that weren't that severe. So it works in both ways. But if you prefer, we could talk talk about the most severe reactions, such as anaphylactic shock. Would you agree that that's life-changing? That that's something that we should look at?
I would still like to respond to like the things that you said like 5 minutes prior in your rant.
Sure, have it.
You're trying to move past what I said without addressing it. So, you're misrepresenting the harm. And if you want to tell me that I'm misrepresenting anything else, fine. But how about you respond to what I'm saying first?
Yes, I just did. I said that
the harm that can come from vaccines.
Mm-hmm.
Oh, can I finish?
Sure.
Thank you. You're misrepresenting the harm that can come from vaccines by looping in with this figure, like itchy arm or some redness or swelling, in that if you actually think that the vaccines are harmful, how about you look at the actual numbers of people that have severe side effects?
Okay.
Okay, so just real quick.
Instead of grouping them in with people that have...
We're at an hour and 10 minutes, so in order to go through this, we would have to not just...
I'll answer this. I'll do it in 2 minutes.
I just want to clarify. We would have to not just go through what's severe, but also compare that to the severe outcomes of the having COVID in each one of those numbers. And if you guys want to go into that, we can, but I just want to make sure.
I'll finish this real quick. It is monstrous to suggest that we shouldn't look at adverse effects because they're not that severe. When your population is already so low, he's blowing up this population that had a previous case infection. You had almost zero. You had far less than 1% chance of having a serious case of COVID. I believe the number was 0.024. But he says that we shouldn't look at it. We shouldn't lump in any side effect that we're increasing your chance of being protected from that already ridiculously low percentage chance of having a serious case of COVID by 0.13%. So therefore, if you have some sort of side effect, we shouldn't look at that. It doesn't matter. Only the most serious side effects should be looked at. So when it comes to even ridiculous fractions of a percentage in protecting cases of COVID, he doesn't say, well, the vast overwhelming majority of those were less than a percentage of being serious cases anyways. He doesn't say that. He was more than fine to misrepresent that. I think it's monstrous to force these people for almost no benefit whatsoever to actually have adverse effects. But if we look at the same studies that talk about the most serious adverse effects, such as anaphylactic shock, it talks about how that your chances of having anaphylaxis reported was 0.3% after one dose and 0.2% of those people after the second dose. That means, according to the CDC paper...
0.2% of 0.3%.
Yeah, 0.2 and 0.3%. Is that not a big deal?
0.2% for the second one, it's 0.2% of the 0.3%.
No. It's 0.2%. It's of the people... They looked at the people
Can you read that then?
Yes. Allergic reaction or anaphylaxis was reported in 26 out of 8,680 participants, 0.3% after one dose of the BNT162B2 or MRA1273, and 27 of 11,140 participants, or 0.2%, after two doses of the BNT162B2 or mRNA1273, or one dose of the JNJ78436735. Got it? So that means that they analyzed people that were going in for their first... They had a population of people, 8,650 people that were going in for their first vaccine. Of those, 0.3% had anaphylactic shock. Then the second time, they looked at people that were going in for their second vaccine. There were 11,000 of them. 0.2 of them had anaphylactic shock. Both of those numbers are comparable, if not... Again, I'll finish this point. According to this CDC paper that we already looked at, those with a previous infection had a 0.0276 chance of being hospitalized with COVID. But this report suggests that if they get the vaccine, they have a 0.3% chance of having anaphylactics. That means the risk is 10 times worse that you'll have a severe allergic reaction from the vaccine than you'll be hospitalized with COVID if you have a previous infection. 10 times worse.
Did any of those people...
I didn't say if they died, and...
Does it say to the people that had...
Why does that matter? You said you don't give a shit about just death. You don't think that severe allergic reaction to the shot...
Well, we've moved on to, we're talking about hospitalizations, and I'm assuming that includes death. No, yeah.
I don't know. It just says hospitalizations.
If we want to talk about risks of COVID versus risks of the vaccines, how about the fact that of all the people that went into the ICU and then some portion of those people died, only like less than 6% of the people that ended up in the ICU had two COVID shots?
I noticed that you're deflecting to something that we haven't even remotely talked about here. What we were talking about is whether
I'm talking about harm.
No.
of the
What you're
shot
doing is
versus the
so.
harm
What you're doing. It's a clever.
COVID.
It's clever what you're trying to do. You're trying to say, but if we look at the general population of people that weren't vaccinated or had a previous case of COVID versus those that are vaccinated, we can see that those that are vaccinated, according to this data, had better outcomes, and very few of them died when they were in ICU. I'm talking about a very specific. We've been talking about two groups here very specifically the whole time. People that had previous COVID.
No. It's not
People
what I
that
said.
had
People that were admitted
people
to
that
the
had
ICU.
previous cases of COVID, right? That weren't vaccinated, and then what happens once they get vaccinated. And what you have conceded and are trying to move on for those people had almost no risk of a serious case of COVID, which would be one that would require hospitalization, but they had a 10 times greater chance of having anaphylaxis if they were vaccinated. And you have nothing to say to that.
I don't think it's as big of a deal as ending up in the hospital with the in the ICU.
But
especially when you're in a pharmacy when somebody can take care of you, you're experiencing anaphylaxis.
Your chances of ending up in the
That's
hospital.
why they have you stay.
Do you think that if you get anaphylaxis, there's a good chance you end up in the hospital?
Not if you're at the pharmacy where you're getting the shot and staying for 15 minutes to wait to see if it happens like you're supposed to.
So I just want to be clear. According to you, you think it's worth forcing people to take a vaccine that have a 0.027% chance of being hospitalized with COVID, even though that vaccine will be 10 times more likely than that number to give them anaphylactic shock. You would say, yes, that's a decision you're willing to make.
When you're saying it like that, you're saying it as though these people are not in a position to be immediately treated and be fine for anaphylaxis.
I rest my case. We can move on to the next stop if you want.
Do you guys want to do closing statements on these real quick?
Sure.
Yeah, okay. It was...
I could go first or second, it doesn't matter. However you want to do it, Drazi.
Yeah, so Drazi, if you want to go first on this one, and then he'll go second, since he opened.
Closing statements?
Yeah.
On this section, then we're going to move to...
I understand. So I'm still for making people get vaccine. I'm still in favor. I think it was the right decision to try to make people get vaccines or get tested. I don't think that getting tested is a very big burden, as Rob likes to point out. If it was the case, then I don't see why he's not hooting and hollering about other vaccine mandates that we do have against children, no less, which should be even more egregious if it's an egregious thing. That if you compare not getting vaccinated to getting vaccinated, you have roughly a 95% chance reduced rate of ending up in the ICU. And if you look at the odds of getting a side effect from the shot, we're talking exceptionally rare. It's not exceptionally rare to end up in the ICU. But also, we never really got to touch herd immunity here. I wish we could have gotten to that, but we were sort of struggling over the numbers. But maybe something for future discussion.
All right, Rob.
I think that it's clear to see the authoritarian nature of this. We just looked at one population size. You could do this with many more people. There were vaccine mandates and pushing vaccines, even if they weren't mandates, on several populations that it weren't worth it, such as young people, other people. When you just look at this one cohort, you can see how insane and authoritarian and unscientific this was. The best data we had at the time that people like Joe Biden should have been reading, and people like Elderdrazi claimed as people that were reading this they should have been looking at, showed that your chances were remarkably low of contracting COVID if you had a previous case of COVID over this period. In fact, they were far less than if you had just been vaccinated. Forcing those people to get vaccinated on top of their previous COVID infection did almost no benefit to them whatsoever of their already very slight chance of contracting COVID in the first place, and their even slighter chance of it being like 0.202% of it being a significant case. For that, we actually slightly, albeit within the margin of error, increased their chance of being hospitalized with COVID by forcing them to take that vaccine. And we gave them a 56% chance of any sort of severe to moderate or moderate to severe side effect from the vaccine. Not to mention, just looking at one of the most severes of anaphylaxis, we saw that there was a 10 times greater chance of them having an anaphylactic side effect than there would have been them being hospitalized in the first place. None of this data matters. He just wants to say, like, no, I stand by it. And this is the problem with the authoritarians with both the vaccine mandates and the lockdowns. It was a one-size-fits-all approach that wasn't scientific at all. It had no backing to it. It was based on a vaccine that they didn't know what the significant side effects would be, and there are many, and they are grotesque. But when you break down down just how monstrous it was to force these people or attempt to force them or shame them into getting vaccines that predictably would have caused them more harm than did them good, you could see just how evil and disastrous this policy was. The last thing I'll say about this is, again, I remind everyone, Elderdrazi claimed that he read all this stuff. This isn't my forte topic. This isn't something that I claim to be an expert on like Elderdrazi. Somehow it seems like he is ill-prepared when it comes to the data, particularly from organizations like the CDC. It seems like he has no interest on. The last thing I'll say is, it is absurd that you just heard this man say that he would have no problem forcing people to get this vaccine, even if it meant that it was 10 times more likely that they would have anaphylactic shock because, hey, they're at the pharmacy and it could be treated.
Or get tested.
That sort of monstrous opinion and authoritarianism shows just how disastrous these sorts of policies were.
Okay, Drazi, you know your camera went off, right?
Yeah, I turned it off for a minute because my wife brought some food and I just ate something real quick. I think it's rude to eat on camera.
Okay.
No problem.
I just wanted to make sure. All right. So we're gonna go to lockdowns, and we'll do the same thing for.
If Drazi would like, I will throw this bone. Since I talked about what I wanted for the first hour, he could take the conversation anywhere he would like.
Ooh. Yeah, I certainly think there's more interesting things than lockdowns. I'll keep it to what I had originally said.
So we're gonna do lockdowns.
I think he wants to change that up. That's fine by me.
Oh, what was the?
I was just checking. I was just checking what I originally had proposed to him to make sure that I'm not. I don't want to throw a curveball. That would seem.
I don't give a shit at all.
Unfair.
It's perfectly fine. Curveball.
Yeah,
I'm not going to complain
I'm
about
asking,
it.
what is the topic?
I like I said, I'm just looking at the list of things that I proposed to him,
Okay.
so that way I'm not throwing a curveball at him. Yeah,
Just jump in, man. Let's go.
I'm
Whatever you
interested
want.
in hearing. Okay, I think that the Trump administration's response to COVID, insofar as deliberately delaying the rollout of testing, delaying any kind of move such as the law, and deliberately downplaying the vaccine or the virus to America, did more harm than anything Joe Biden could have done.
Okay,
you
so
were
it's
breaking
Trump's
up a little bit. Go ahead.
But it's Trump's response. Okay, so you're going to do your opening statement.
Trump's response to COVID, so far as telling virus came to the United States, deliberately delaying the rollout of usable tests, and just those two. That's fine. I think that those are both more dangerous than anything that Biden had done.
Okay, so yeah, go ahead and start
in
with your
regards
opening
to
statement. You got 2
The
minutes.
coronavirus pandemic.
Is that it? Is that your opening statement, or did you want to
do
give
I-
an opening statement on those?
That was my topic.
Yeah,
Do I
so
go first
I'm
for
saying
opening
go
statement?
ahead with your
I don't know.
2-minute opening statement. Go ahead.
Oh, okay. When the coronavirus first came to the United States, we had several weeks went by before there was any kind of alarm sounded by the White House. Trump deliberately, on purpose, downplayed how bad it was, how much it was spreading, withheld information from the public, continued to reassure everybody, saying everything is totally under control. When we had COVID spread to 6 states, he still kept the same rhetoric. We had tests that were available. All that was needed was an executive order to allow us to use them, because they didn't include an extra thing to test if somebody had COVID. That was why we couldn't use it, because there was a certain regulation that had that stipulation there. Trump's administration was aware of it, and they decided not to push it through. This would have caused no additional harm. It would have just allowed us to test for COVID, and they decided that we're going to do this. This prevented us from being able to do any kind of tracking of the virus, and instead, the only resort that we had after that was lockdowns, which I agree could have been avoided if we would have taken it seriously to begin with. And because of that response, we were the worst nation in the world for COVID many times over. And I don't think that anything that Biden could have done could have possibly been worse than what Trump had done for the United States for this pandemic.
Okay. Thank you. And then Rob, 2 minutes.
Got it.
Okay, so in general, when it comes to the specific executive order that he wanted a PCR test to be put, I'll leave him present forth evidence that he wants. In general, I think Republicans, Democrats, and the Trump administration and the executive did make a mistake in many of the ways they were focused on COVID, where they were putting out thousands of pages of COVID bills that had more to do with things like diversity hiring in several organizations and where all this money would go to places like Boeing, etc. And it didn't include specific things for things like PCR testing and things of that nature. So in general, I think everyone could be to blame for that. I don't know that the PCR test being out at the time that he's suggesting would have prevented lockdowns. There are other nations that had PCR tests that also locked down. There were also many problems with those PCR tests, particularly at the beginning, where you were having things like false positives that arguably made things even worse, because a false positive would mean that we thought that hospitals were going to be overran, etc., which led to disastrous health outcomes in other ways. There were also false negatives that could occur, which mean people felt safe to go out even though they had symptoms. So waiting for those PCR tests seemed to be in line with what Dr. Fauci and other people would say. The other thing is, when it comes to Trump downplaying, he's damned if he does, damned if he doesn't, because oftentimes what we're told was he wasn't an expert and he should listen to the experts, which is exactly what he did when it came to the initial outreach of what was going on with COVID. Dr. Fauci, for example, in February was saying that the flu would be worse than COVID that year. It was a mere half a month later or so when Trump was suggesting banning travel from China, to which the Democrats, including Joe Biden, was saying was xenophobic. Nancy Pelosi was saying go out and hang a China person at Chinatown. That's how much they were downplaying it. The only thing Joe Biden did in his administration was rely on the vaccines that came about under Donald Trump, although he initially put hesitancy in those vaccines, saying he wouldn't trust them because they were coming from Trump. The only person that seemed to put undue influences on people at these organizations was the Biden administration, where we had two people from, I forget the organization, EPA, I believe, that retired and quit because they said they were being pressured by the Biden administration to approve boosters. So in all of those things, I think that Biden, there's no evidence he would have done better. And in fact, it seems like him and the Democrats would have done remarkably worse.
All right. I don't know. Do you guys want to cut this one a little bit shorter because we went over 15 minutes on the last one, or do you want to just go an hour and just see how it goes?
I have no hard cutoff. Whatever Drazi wants to do.
Okay, I'll just let you know at an hour, and then we'll see where we're at then. All right, Drazi, go ahead.
Okay. Incredible other people, but when we had gotten our first 25 million tests done, Trump encouraged us to slow down on testing. He said, the more tests you run, the more people you're going to find. He called it a double-edged sword. I think this is the rhetoric that he used throughout the first part of the pandemic, which was pretty consistently about how COVID would make him look. What do you think about that?
No, I think that first I'd love to see your quotes. I'm aware of him saying the more people you test, the more things will come. I was unaware that the context of that was saying, therefore, don't test people. I think this was in response to people saying the number of people being infected is increasing, and he said, of course, the more people... Go ahead. You have something to say? Go for it.
The exact quote is, when you do testing to that extent, you're going to find more people. You're going to find more cases. So I said to my people, slow the testing down, please. That's the exact quote.
Okay. Well, in that context, then, if he said slow the testing down, I would love to see that quote, the full context of that quote. So if you could link it in the text, I'll be happy to read it. But let's say, for the sake of argument, while you're presenting that evidence...
Do you have a source you're comfortable with?
What's that? What was that?
Do you have a source that you're comfortable with?
You're reading it from somewhere.
What kind of sources are you comfortable with?
You're reading it. What are you reading it from?
Well, it's on a couple of them.
Okay, then I'll say I'm comfortable. Okay? I'm comfortable with Tucker Carlson. So show me Tucker Carlson saying that he said that. Go ahead.
Is Tucker Carlson
yes,
the only
that's
source
yes.
you're okay
Tucker
with?
Carlson. Yep, that's the source I'll take. Go ahead. Oh, you don't have it?
Okay.
Oh, okay.
Well,
I guess that argument's moot.
I don't think that we can use sources.
That's great.
Okay.
When
well,
I ask you, so I get the smug. So allow me to retort. I was
just trying to make sure that I give you a source that you were going to accept. I didn't know that your sources were so narrow that you only trust what Tucker Carlson has to say.
Are you finished? Are you finished? Would you like me to respond? You're running the show, so if you would like on this topic to continually interrupt with your laggy ass internet, that's fine. Can I respond?
Yeah, I stopped talking.
Okay, so when I asked you what sources you were talking about, I was talking about studies that actually looked at data that was talking about these things. So I asked because I didn't want to source something that you would later say, I don't trust that. I'm more than happy if you say, here is a quote from Donald Trump, and you present it from CNN, or from the Washington Post, or from a video that was on YouTube, or from the New York Times, or from Fox News, or from Breitbart, or any of those other places. If it is a quote, and then we could verify this was a quote that made, I have no problem, whatever source you would want. Whatever you're reading from would be sufficient for me to read this quote. You're trying to be smug because you were proven that you don't actually read the most prevalent sources that Democrats would trust, like the CDC, even though you claim that you were an expert that's read almost near anything when it came to the efficacy of forcing people that had a previous infection of COVID and whether or not they should take a vaccine or be forced to follow through with the vaccine mandate. And so now you're trying to be smug on this topic, which is fine. It doesn't suit you well because not only you're not good at debating, but you're also not good at being humorous or trying to get me in these alleged gotchas. So I'll take whatever source you want. Nonetheless, what I'll say specifically to this quote, if you would allow me to answer specifically on the quote, yeah, there's no evidence. I think it would be a bad thing if Trump was saying specifically that we shouldn't test because he was worried that the amount of numbers were going high. There could be reasons for why he would say that, but wording it that way is definitely poor. For example, you would say that if we were saying that the number of people getting infected were going up and therefore we should lock down, maybe we should put the reins on that because we don't want lockdowns. But it's still a terrible way to say it. The way I would say it is, it doesn't matter exactly how many people are testing positive for COVID. The question we should ask ourselves is, how many severe negative effects are we have? And do things like lockdowns solve that? And I think the answer to both of those would be that no, lockdown shouldn't solve that. And it seemed that when it came to hospitalizations, on average, over the course of the pandemic, hospitalization and ICU beds were down compared to what they'd been to previous years. But yeah, I disagree totally with Trump saying that statement. Okay?
Okay, that's all I asked. And then you asked for a source, and I was just trying to make sure that I was going to give you a source that would be acceptable.
I think you were being smug and we could all see it, but that's fine. Okay, anything else, Dan?
On what you just said?
I mean, whatever you want to talk about.
Sure. Do you not believe that the Trump administration could have pushed through tests that did work? The first test that did come out, they got rushed, but we had tests that were perfectly viable to use, and all they needed was an executive order to be able to go out because there was a regulation stopping them from being used because they didn't test for something else also, that they tested for something else also, not just COVID. And therefore, they couldn't be used for this instance because of a regulation that could have been pushed through by Trump. They were aware of it and they chose not to do it. Do you disbelieve that?
No, that sounds like
for that.
I'm unaware of that.
I can get you one.
I'm unaware of that.
Okay,
but okay, you want me to answer? I'm unaware of that, but that certainly could have happened. I've conceded the entire time at the beginning of this that I thought testing was one of the areas that Trump administration, that the Republicans and Democrats that were spending these billion, if not trillion-dollar bills that were designed to fight COVID in an emergency way, were failing in many things. They were failing, for example, on testing. They were also failing on other treatments that could have been used to treat COVID that weren't necessarily vaccines. They were failing on just sort of things like public knowledge. Trump owns this. So do Democrats. So do Republicans. For example, there were questions that people I knew had. There were simple questions about things as simple as like hand washing or the way to wear your mask. Why wasn't this shit being talked about by the Trump administration every night on national television? It should have. Why wasn't it being talked about by Democrats? Why wasn't it talked about by Republicans in the House or Senate? It was absurd how little information was getting out there. So yeah, when it comes to testing specifically, I criticized the Trump administration in real time. I criticized the Democrats that were in charge, I believe at that time, of the Senate for the spending bill that they were putting out that didn't have anything specific about testing. It didn't seem that there was a big push from Democrats to be pushing things like testing that should be going forward. But certainly there were a lot of problems once we started to get testing that it seemed like it didn't solve things in the way that even I thought that it would do a better job of doing.
Okay. Do you acknowledge that Trump switched his rhetoric on COVID once it started to infect more states? And deliberately downplayed COVID the entire time that it was affecting primarily blue states?
No, I don't acknowledge that. I think, in fact, a lot of what was going on, for example, let me preface this, I know this isn't good form, but would you admit that Dr. Fauci has no reason to carry water for Trump? He doesn't seem to really care for him, correct?
I don't know.
Okay, well, Fauci, when we had the infamous, Trump talked to, was it Bernstein? Trump talked about how serious COVID was behind the scenes to Bernstein, but publicly he was saying different things. Fauci went on national television and said, actually, the things that Trump is saying publicly were in line with what we were recommending to him. And one of the overall problems, what you're saying, I'm actually going to be more charitable to you than most people would when saying that I still do believe that the buck stops with the president at some level. But the Democrats were saying that Trump should have taken a back seat and it should have been people like Fauci and Birx that were running things. So the question I I have, seeing as how Trump's not a virologist or an epidemiologist, if he was going in line with what Fauci and Birx and others like Francis Collins and others were telling him to do, what is really the blame to him? So, for example, we see that right out of the gate, we saw that Fauci came out and said, oh, don't worry about masks. They don't work anyways. You don't need them. Then he came out a month later and said, actually, we lied. We were worried that you were all going to have a rush on masks. We didn't want to panic everyone and cause rushes on, shortages of food and toilet paper and masks, etc. So we intentionally lied to you. Given that was clearly the take from Dr. Fauci, that they were trying to not induce panic, I have a difficult time on this topic specifically, blaming Trump for listening to Fauci and them with a message of optimism, saying, look, we're going to get through this. It's not as bad as it seems. If that's what his team was recommending that he do you think he should have overruled the rule of them and said, I don't care what Fauci and Birx, etc. say, I'm going to go out and say, oh my God, this is really shitty, we're in a lot of trouble?
If you think that he had different information available to him, that what Dr. Fauci was saying was not correct, then I would say, yes, he has a duty to the American people to tell us that and not go in line with what this guy is saying. I think it would be his duty to expose that and keep the American people safe.
So you would argue that you could never foresee a time where an executive administration should downplay a situation because if they didn't, there would be mass panic or something like that would make the situation worse.
Are you suggesting that's what he was doing?
I'm suggesting it seems to be that that's in line with what Fauci, etc. had done. That's the exact rationale they gave for why they, according to their
I'm talking about
words,
Trump.
Right. What I'm saying is he was listening to Fauci and them. We know that Fauci and them already admitted in a previous scenario when it came to the mask that, yes, we lied to people because we didn't want to panic them.
So you're saying that Trump did know what was correct, but he decided to say what Dr. Fauci told him instead.
No, I'm saying that Trump probably had some base idea that COVID was a serious situation, which he never denied that it was serious. He didn't really deny that it was serious. But I think that he was listening to people like Fauci and them that were saying, here's how you approach it. A message of optimism. You don't want to freak people out. And he said, okay. Did he know, that what he was saying was a blatant lie? No, I don't think he knew that. I think that he had reason to believe there was optimism because of the people around him. For example, he was accused of lying over and over again, saying the vaccine's on its way, it's going to be here. And almost every expert and talking head from the Democratic Party was going on television saying, it's impossible. It can't be here in that time frame. Trump is rushing it. It will be dangerous. He can't say things like that. And then it turned out he was correct, and they immediately went from, I wouldn't trust it, it's dangerous, to, not only do we trust it and it's the best thing ever, but you should all be forced to take it.
Okay, so you're saying he never made it seem like it wasn't that big of a deal. He repeatedly said that it was just going to vanish. Countless times he said it's just going to disappear, it's just going to vanish.
And?
At the beginning of the pandemic. You don't think that's him not taking it serious?
What month?
You just said you don't think that he
what
ever...
What month did he say that?
It wasn't serious.
What month did he say that?
He said it in October before it got here, and then throughout several months of the pandemic, he repeated this rhetoric.
Okay, what other month other than October before it got here?
There's a quote of him. He repeated it 5 times in February. He repeated it in March.
The question is whether or not that's actually
downplaying
it based on when
he's.
I think I'm muted.
No, I heard you.
He said what month?
His question is, his question is
April.
Is it downplaying based on when he said it? So is the information that we have at the time actually enough for him to know that he is saying something that is downplaying it?
Okay, so I'll answer this in two ways.
Yeah,
I'll answer this
through all the months. July.
Okay, I'll answer this in two ways.
Several times.
I'll answer
August.
I'll answer this in two ways, right? One, yes, when he was saying things in October, February, etc., remember the person that he's supposed to be listening to, Dr. Fauci, was saying, it's no big deal, actually, the flu will be worse. But you say that he said, and I'm quoting now, several times in August, this is nothing to worry about, it will just vanish on its own. Can you show me those quotes?
Yeah, I have a whole list of them.
Sure, I'd like to see the ones in August.
I'm also talking October 2020.
Right, I'd like to see the ones in August where he said, don't worry, it'll vanish on its own.
I'm sending it to you.
Okay.
Also, past that, he said it's going to run its course and just vanish.
Yeah.
Beyond August.
Okay.
Oh, wait, I can just look at the DC text?
Yeah.
If you want video, I can pull that, but it's going to take.
If there's a video, it'd probably be best if I shared it so that you don't crap out.
He's
It's
saying,
not,
so
I
here's
don't
saying,
have
so
low
I'll read some of
speed,
these.
I just have,
What I'll do is, from your CNN article you said, I'll read some of them. Now, granted, it doesn't have the full context, it's just one sentence, and we do know that sometimes the context around things can change, but this is the information we have around. So I'll read the specific quotes, some of these, as opposed to just saying, yeah, he said this all the time. So here's things he said. I don't think people are panicking. This is in March 6, 2020. I don't think people are panicking. I said last night, we did an interview on Fox, a town hall. I think it was very good, and I said, calm down, you have to be calm. It'll go away. That was in March. Let's go a little further. Let's see. April 3rd, he says it's going to go away. It'll go away. Let's see here. You said, let's skip to a little later. You said July. And I think we're going to be very good with the coronavirus. I think that at some point it's just going to... Okay, July 1st, 2020. I think at some point we're going to be very good with the coronavirus. I think that at some point it's just going to sort of disappear. I hope. July 22nd. We're going to beat it. Yeah, we're going to beat it. And with time, you're going to beat it. It's going to be okay. You know, I say it's going to disappear. And I say, oh, and they say, oh, that's terrible. He said, well, it's true. I mean, it's going to disappear. Before it disappears, I think we could knock it out before it disappears. And frankly, this is August 13th, 2020. Frankly, you know, we've had a tremendous market. You know, I've talked about that, the stock market. Think of it. We're almost back to where we were. I'm still in the pandemic, which is going to go away. And I'll say it'll be going away. And they'll scream, how can you say that? I said it because it's going to be going away. Sounds to me like what he's saying is eventually we'll get through this. It will go away. This is in line with science that talked about how things like natural immunity would actually mean that we would have protection from this at some point once we got sort of a herd immunity. So I don't think he's saying anything as nefarious as you seem to be implying here. The idea that this was downplaying, what's the alternative? Was he telling people to go hug a Chinaman? Was he saying that it would be xenophobic to stop travel from places where the virus was, like China? No. It seems that I can't hear you. I believe you're muted. Okay, that's cool. We can do the rest of the debate like this.
Oh yeah, my dog was barking, so I muted it out of courtesy. I think the alternative would be to discuss the reality of the situation that we were facing.
Okay, yeah, the reality of the situation, which was what? That there was mass-induced panic that the panic was so bad that we did things like force COVID patients into nursing homes that led to tens of thousands of deaths. That would have been a better alternative.
Yeah, Rob. I think that's a good. You know what I'm suggesting that he say.
Okay, will you acknowledge that there were many people, particularly in blue states, that were so panicked by COVID and overselling it that they, as a rationale for that, forced COVID patients into nursing homes?
I can't tell you exactly why they did what they did, but I can say that when they can see the reality isn't matching up with what the highest level of government was telling them, by repeating rhetoric like everything's fine, it's going to go away, everything's completely under control. When you're saying this kind of rhetoric over and over again, I think that people aren't going to be able to trust the highest levels of government to inform them, and that's going to raise not just suspicion, but yeah, it's going to induce a lot more panic because they can't trust what should have been the most reliable source on what is probably the biggest global event that we'll see in our lives.
Okay, so first off, I would say that
itself to a lot of panic.
I would say that actually goes the exact opposite way as well. For example, one of the things that Democrats supported is Dr. Fauci. Do you support Dr. Fauci? Did you support him, by the way?
I don't think he's done anything that was particularly egregious.
Well, you are aware that he initially lied about the efficacy of masks, admitted that he lied because he said that he was afraid people would panic and go mass buy masks, which meant that medical professionals wouldn't have them. You acknowledge he did that, correct?
Yeah, and he was right.
So it was okay for him to lie about the situation.
It was, I think that it was an understandable lie to tell at that point in time, and we needed to have them. Yeah. Can you explain to me what the benefit of what Trump was saying was?
So what I'll do is I'll get to explaining the benefit.
And then the same way that Fauci She had the benefit of the mask thing.
So
because
I'll get to that, but
hospitals across the United States.
I'll get to that, but I'll stay on the point that we're on. So initially at this, you heard Elderdrazi say, no, at no point should someone tell the noble lie. You always have to tell the truth. That's something that needs to happen.
I didn't say that.
Yes, you did. That's what you implied earlier. That's what you said going back. I said, can you envision a situation where
I was talking about Donald Trump.
Oh, so just with Trump. With Trump, he always has to tell the truth, and he can't tell the noble lie to stop people from panicking. But Dr. Fauci, it's okay for him to do it.
If you want to give me an example where Trump told a lie based on a fear that ended up coming true, that thing coming true made the situation worse for everybody, sure. I think what Dr. Fauci did was the correct approach because he was correct. The result was what he had predicted that it would have been if he had made that announcement. If you think that Donald Trump had lied in the same manner,
let's start. I promise we'll get back to Trump.
I'm talking about Trump because he's the president.
We'll get to Trump in a second. Let's talk about this noble lie that you support from Fauci again here in a second. Do you believe that do you believe cloth masks are effective?
No.
Do you think Fauci said that?
I don't know.
So you were against masks.
There was a lot of changing rhetoric.
So you admit mask mandates were bullshit because cloth masks aren't effective.
I think that using a cloth mask to abide by a mask mandate is ridiculous.
Okay, what type of mask should we abide by? Only N95 ones?
Yeah, that's the only ones I've ever used.
Okay, so just to be clear, you're aware that none of the mask mandates said that you had to wear an N95 mask. And probably 90 to 95% of people were wearing masks that weren't N95 masks, which you're admitting weren't working.
Yeah, sure. I think that could have been handled better.
Okay, absolutely. And you admit that Dr. Fauci said those masks were effective. Maybe not as effective as N95, but they were still worth wearing?
I believe he said that when that was the understanding.
So he was wrong at the time?
Yeah.
Okay, do you believe...
I'm okay with people being wrong.
Okay, fair enough. That's perfectly fine. Do you believe when he came out and said, never mind, we lied to you because we didn't want you to mass panic and buy masks, do you believe at that point he thought cloth masks were effective?
I don't know.
What do you mean you don't know? That's what he was saying.
Oh, if he said it, then sure.
Okay, then my question to you...
What you had presented to me.
Sure, then my question to you is... My question to you would be, if he was telling the noble lie, why didn't he do this? Hey, everyone, don't panic and go rush and buy N95 masks, which are the only good masks. Actually, the paper masks and the cloth masks are effective as well. So do you have one of these at home, a shirt? If you have an extra one, why don't you just cut it, tie it around your face, and that'll give you prevention? Why didn't he say that? Why instead did he intentionally lie and in his belief, in his own words, tell people not to do something that would significantly protect them from COVID? And you think that was a good thing? That he lied and jeopardized people? When he could have gave them an alternative in his mind that would have been successful?
No, I think that he did what he thought was the best thing.
I disagree. If he thought cloth...
People can make mistakes, and that's fine.
No, it wasn't a mistake. If he thought at the time he made that statement that cloth masks were effective, and he knew that anyone could make a cloth mask with even an article of clothing, why wouldn't he have told them that? That would have still stopped the panic buying of N95 masks. So why did he do something in his own words?
I'm not here to tell you why Anthony Fauci did anything that he did.
That's absolutely right. I
can go based on you can go based on data whether or not it seems like he was acting maliciously. I don't think that he was acting maliciously.
Well, the data, how does the data prove if he was acting maliciously or not? What sort of data? Give me the data.
I don't think there is any that suggests he was acting.
Well, what would that data look like?
Let's say we had white papers that showed that cloth masks were wholly ineffective, and then he said you should wear cloth masks, they're effective.
Okay, so the point I'm making is we don't need that data point because he said publicly that cloth masks were effective. He said that all forms, of course he said N95 were superior and that you should get that if you could, but he said that all these other forms of masks were better than nothing. It seems evident that he truly believed that. My question to you is, if he's lying to prevent people from buying N95 masks, why can't we say that clearly he was intentionally jeopardizing people in his own mind, but said it was worth it for the greater good, but he knew that he could have told a different lie that would have been far safer for those people, which was make your own cloth mask, which he didn't do.
Okay. You're asking me to specifically know exactly what he was thinking. He said, I don't know that. And I don't need to know that, make the case that I'm making. Which is that I do think that he was acting in the best public health interest.
The topic that you've settled on is asking me to know exactly what Trump was thinking when he said things. The reason I bring up Dr. Fauci in this context is you initially said, when I was like, look, I don't agree with everything Trump said.
Me an allow me to finish.
There's a delay, so you have to allow me to finish. Right? The reason that this came up in the first place was I made a point that clearly there's a bunch of things that Trump handled this that I vehemently disagree with, which I admitted at the outset. And I said I don't agree with all of his rhetoric. However, I do understand that basically most of what he was saying, Dr. Fauci said was in line with what they were saying because they didn't want him to induce panic. And you said, no. He has to tell the truth no matter what, even if it induces panic. And then you immediately, when it comes to like, okay, but Fauci lied in an attempt to not induce panic, you're like, yeah, he did the right thing. And so it seems clear that you have a double standard on this. That's why we're bringing it up.
Hang on. You're saying that Fauci said that most of what Trump... He consistently said that what most of Trump said was in line.
No, I said in my opening statement...
Or did he say that one time?
I said in my opening statement what he said when reference... Go ahead, I'll leave you get out what you want. There's a delay, so I'm not even doing this to be a dick. There's a delay, so I'll wait until you're totally finished with what you're saying.
Stop, you have to kind of let them go because once you stop, he's going to start talking, Drazi.
Because I'm a debater. That's how it works.
The question...
Yeah, of course.
The question is, do you think that Fauci was consistently supportive of what Trump was saying, or are you trying to express that he said it the time?
Okay, what I said in my opening statement was, in reference to the Bernstein interview, where most people were saying, see, this is proof that Trump's intentionally lying, that he thinks will be bad, Fauci came out and said what he's saying was in line. In other words, what he was saying at that moment when the heaviest criticism of Trump misleading the people was basically we're saying that Trump should have a hopeful message. We don't want to panic people. Did Fauci come out numerous times after every time that Trump said something like, oh, we're going to get over this? Did he come out every time? No, I don't think so. But I think it's clear that in the middle of this, in the most significant instance with this Bernstein interview, that it seemed that Fauci said, he's basically saying what's in line with us. Do I think Trump could have been more careful with his rhetoric when he's saying that it's going to disappear? Sure. I think he should have been more sober-minded, but I think ultimately the far greater sin was the people that panicked people too much, because they said things like mask mandates, they said things like locking down, they locked down children, they forced COVID patients into nursing homes. These all had significant effects that will affect our economy going forward for the next 10 years, if not longer, affect the development of children going forward for their lifetime, and affect people's mental and physical health in ways that we'll probably see for the rest of our lives. And I think that over-inducing of panic from people that didn't know the science was actually worse than any underplaying it that Trump did.
And you don't think that Trump underplaying it resulted in people having much stronger, more panicked reactions to?
Well, I think
was clearly it was not the truth.
Sorry, you were.
It's delay.
You guys say the last part of your sentence.
Yeah,
again,
the internet connection.
I don't know what the last part of what I said was. Just go off what I said.
Can I repeat and you just nod your head if you think what I was saying? I don't think that Trump underplaying it could have had a significant effect that made things worse in certain ways as well. Is that roughly what you were saying?
Insofar as people panic, yeah, because they couldn't trust the highest report on what was going on to them.
No, I don't think that it caused people to panic more because of things Trump was saying. I think that the people that were predisposed to not liking Trump were always going to panic because you saw the Democrats that after initially downplaying the virus worse than Trump in ridiculous manners, like Nancy Pelosi saying go hide a Chinese person and it's xenophobic to stop travel from China, they became incredibly hyperbolic, trying to put the blame all at Trump's feet and saying that it was the worst thing ever. So they were already predisposed to be panicked no matter what. Had Trump said anything other than coming out and saying, saying, oh my God, we're all going to die, it's my fault, those people would have panicked because their leaders were telling them to panic. Do I ultimately think that there was some amount of harm of underplaying? Yes, there certainly is a potential to cause harm from downplaying something or from overplaying it and causing panic. Both of those things are true. I'm saying the overplaying it had far greater net effect of being bad, but certainly I would have preferred Trump be as accurate as possible, and I don't think he was that. In many ways, I think, though, Trump was sending mixed messages and many times was actually overplaying the danger of the virus, such as when he criticized Brian Kemp in Georgia from lifting lockdowns, and he also heavily criticized Ron DeSantis. Both of those was overplaying the severity of COVID in ways that I think were far worse than the times that he underplayed it.
Who do you think said that we're all going to die?
Who do I think said that?
Yeah, what Democratic official was saying we're all going to die?
I think that I'm being hyperbolic, but what I'm saying clearly is that they were saying that the pandemic was going to be something that was far worse than it was going to end up being. Most of the damage that came from the pandemic was because of the reactions to the pandemic and not the pandemic itself. Disastrous things like lockdowns, forcing COVID patients into nursing homes, forcing children to be home from school, forcing the stopping of the economy. Those outcomes were going to be worse, not necessarily in real time, but over an extended period of time, which is why we're in the position we're in now, where people can't afford groceries, where we have schooling for children is so significantly declined for the children that went through it, other medical issues that are causing excess deaths. That's why you see places like Sweden that didn't do lockdowns actually doing better than the countries around them that are sort of commiserate, because they took other measures that weren't lockdowns, and it led to less excess deaths.
Do you think that lockdowns caused excess deaths?
Yes, undoubtedly.
No, how?
Oh, how? Many ways. Such as the first way that lockdowns would cause excess deaths is because it disrupted the supply chain and the global economy. And it is a clear line that we've seen from economists throughout probably all recorded history, that the more poor that an economy gets, the more that it causes excess deaths. This could be at the base level of things like starvation, which I believe the World Health Organization talked about the increase in the amount of people that were in starvation because of the pandemic and the lockdowns and the supply chain starting. But it also could do things of like crimes or deaths of misery, such as people that became alcoholic, people that became drug addicts. Then there were people that weren't getting treatment for other illnesses. I could give you anecdotally, my brother, who had severe epilepsy, was scheduled for brain surgery to cure his epilepsy. That had to be put off for like 9 months because all of the hospitals in this region, even though there were almost no cases of COVID, were shutting down the hospital for people that were getting those sorts of treatments because they were panicked that any moment there could be a mass influx of people that needed ICU beds. And so basically the hospitals were so empty that they ended up laying off dozens upon dozens of nurses because they were no longer making money. So there are tons and tons of ways that the lockdowns cause people to not get other sorts of vaccines. It caused people to not go for preventative treatment, such as treatment for heart disease, cancer, prostate screenings, things like that. The numbers are quite stark that there was quite a bit of damage that was occurred by the lockdowns. And they were unnecessary. They didn't have almost any benefit whatsoever.
Are you suggesting that there weren't hospitals at peak capacity?
No.
And they weren't prepping for something that was a real reality throughout the United States?
Of course there were individual hospitals that could be at peak capacity, but you could take any year and any virus, even the common flu, and you could see that there were times that individual hospitals were at peak capacity. The numbers seem to suggest that overall, the amount of hospital beds being utilized during COVID was slightly less than it had been in the 5 years previous. So on average, no. The idea, of course, you could point to a couple hospitals and saying, well, this hospital was at peak and this hospital was at peak. But if overall the amount of beds being used had declined, then it goes to show that the panic narrative we had, and again, I would like your answer because I think that both of us are human beings and we are against excess deaths and unnecessary deaths. How could you defend, or what is the rationale that you think you would have for these governors, Democrats, all of them, that forced nursing homes to take COVID patients? Like, you're aware that the people in nursing homes would have been the most likely to have died or have a significant case of COVID, and yet we forced them to accept COVID patients while simultaneously locking down young, healthy people from going to work because we said, if you don't, grandma may die. How can you defend that? The only possible defense, and I'll shut up and leave you answer, but the only possible defense I think you could come with is, well, they were scared, which goes to my argument that the people that over-panicked were worse.
I don't think that the hospitals that did keep beds open was not a irrational response. 1 in 8 hospitals were at 95% of their ICU capacity in 2021 and 2020. I think that
What's
it's
that
pretty
number
low
on an
to
average year?
try to. What's the number on an average year?
Yes.
I would assume the vast majority aren't at capacity. Otherwise, they'd make bigger hospitals, right?
So I'll try to. This is a lame excuse, I know, but I'm not at my home computer. At my home computer, I do keep tabs frequently on hospital utilization in the United States. The data I saw showed that on average, hospital utilization was down over the years 2021, 2022, 2023, the peak pandemic years. So is it true that there could be 1 in 8 that were at near peak? I think that near peak number, if I'm not mistaken, is 95%. Ones that were at least at 90 or 95%. Is that correct, what you're reading?
It was 95% is what I was reading.
Okay, yeah, that's what I thought. I've read that study as well. That could be true, but what you're missing is that's true all the time. That's probably true right now. That's probably true for this year. That was probably true in 2018, 2019. So yes, you could take all of these years and say, yeah, there was peak capacity in many of these hospitals in 2018. Would we then intentionally send people with infectious diseases, infectious respiratory diseases, into nursing homes? Of course not. We wouldn't do that. That would be considered monstrous.
Yeah, I don't see anything that suggests. I'm looking through a bunch, and it seems like hospitals at about half capacity is like the trend.
That's not true. And unless I'm brutally mistaken, I don't believe that's true.
Yeah, that's all that's the only thing I'm seeing for like a high number is like about 55% capacity.
I mean, I'll just have to say, I'll probably.
That's for 2018 at least.
This wants me to.
I was already looking at
what year
2018
was
when you suggested 2018.
Wait,
2018.
did you say 2018?
There are ways that I can find this.
Like
So the best,
how full hospitals are normally.
the best reporter in the country on this, in my estimation, is a man by the name of Phil Carpin. Though I'll admit that I'm biased. But I think Carpin's did a fantastic job on this, of presenting this. So that's where I got this information. Is it true that he could have been incorrect? Sure. Like I said, it sucks that I don't have access to this right now, but I'm going to try my best before this debate ends to find the charts and the data that suggest this. It's actually more difficult than you would think.
I have a list of all the hospital beds in 2018 of Colorado, and none of them are even closed.
If you guys don't mind, I mean, the only things that I keep reading, keep saying stuff like the average number of total staffed beds for hospitals is 130 according to Hospital View. The chart shows a distribution of hospitals by their bed size for 2023, and then also shows 2028. And then what was your number for 2021, Drazi?
Well, I had 2021. 1 in 8 hospitals were at 95% capacity. For their ICU bed.
And did you get what that criteria was to be
from Colorado?
What did you get? What is the criteria for peak capacity?
95% or higher.
So here's what I have. I'll present this to you. It is a graph that is from healthdata.gov, right? And I'll present this to you. You do what you like with it. I'm going to put it in the VX chat. And I'll bring it up for my audience to see as well. So this is from healthdata.gov, so it's a gov website. What you'll see here is if you look at it, the red line is the 7-day average pandemic census of hospital bed utilization over those times, right? So you can see, for example, on 7/26, 8/16, etc., that red line. And the blue is the average in each year of a hospital bed utilization. And you can see that on the average years, it was higher than during the pandemic. Now, this is the hospital average census, which I believe is...
Oh, this isn't accounting for ICU beds, though.
Well,
this is what we care about.
Okay, well, that could be true. It could be true that ICU beds are uniquely different, but that seems to paint a stark picture that when it came to hospital utilization in general, right?
Yeah, the reason why they weren't taking a lot of other people for other things is because there was people with COVID in the hospital.
Right, which is part of my argument that it is part of it. Now, I don't know that you're right about the ICU beds as well.
That's the only I was talking about. I was only talking about ICU beds. Oh. And I did link I don't know, a graph chart, whatever. It's a breakdown of all hospitals in Colorado in 2018, and it shows how much each individual kind of bed was being used, but none of their ICU beds were anywhere near capacity for the year of 2018.
So here's Kirpin says, DC dashboard total hospitalization beds under 400. COVID ICU census 65, lower than the same date last year. With 1 day left in the month, January COVID-associated dashboard deaths total 70, down from 128 last year. That's not answering the question.
We'd have to super stick on this. It seems
here's
like
more. Here's more data. I mean, the data I'm looking at suggests you're incorrect. It just does. Like I'm looking at here now, again from healthdata.gov. Total staffed inpatient beds, 7-day average inpatient beds, inpatient beds used, confirmed influenza patients, COVID patients, 7-day average total staffed. Right. Even these numbers seem to suggest that the hospital, the ICU, the inpatient beds. This goes from 2020 to 2022. I don't know. Okay, it's something. So it's something. It's sort of a moot point. I think that I'm correct about this. I think that the narrative that all of these hospitals were at capacity or was so much worse than normal, I don't think is true. But I will fully admit that I don't have that data to bring to bear right now. I don't think you're providing data that really suggests otherwise, that shows that it was massively more abnormal than other years. And I think that we're conceding that at least the data shows hospital beds in general were down over the time of the hospital. Nonetheless, the specific question of over-inducement of panic forced things like sending COVID patients to nursing homes. How can you defend that?
Why would I be defending that? I said that the
He's giving you a dichotomy of
did worse than the Biden administration did.
Okay, well, let me rephrase the question.
Dichotomy.
Let me rephrase the question. It seems that we're having a discussion about what caused more harm, the underplaying of COVID or the inducement of panic by overplaying COVID. I say that the only rational reason I could come up with of why these states would send COVID patients to nursing homes was because they were over-panicked. And therefore, when we see the tens of thousands of deaths that occurred in states like mine of Pennsylvania at nursing homes, and then in states like New York where they intentionally tried to cover up the numbers, that seems to suggest a real harm that led to real tens of thousands of deaths because of the over-panic. Do you have any argument as to why over-panic isn't to blame for that?
I don't see any reason why I think that over-panic is to blame for that. It just seems like people made the wrong call.
What would can you give me any hypothetical reason why they would have sent COVID patients into nursing homes other than that they were panicking?
For whatever reason, they thought that was the best move to make. I think that it was the wrong move to make, and I support it. So I'm not really attuned to understanding why somebody would do something that seems very wrong.
When you said
but I don't
that, when
think
you
that
said
there's any
earlier,
reason to think that.
Okay, sorry.
He's telling you that it's panicking, though, so he's already giving you his rationale for why he thinks that they would do it, and he's saying that their panic is so high that they are willing to go and do something drastic because of how much they're panicking. So you saying, well, I don't think they would do something wrong on purpose. He's saying, well, I'm already giving you the rationale for why they're doing something wrong. They're panicking.
I
think that they thought they were doing the right thing.
But there's no rationale for why they were doing the right thing. For example, I've done this experiment dozens upon dozens of times. Tom, do you mind being a guinea pig here for a minute? I know it's not conventional to ask the moderator, but do you mind? If I was to ask you, Tom, you're not a virologist, right? You're not a medical professional, correct?
Not today.
You would call yourself an average person, a layman, when it comes to sort of understanding of virology. Okay. If I was to say to you that there's going to be a respiratory virus that's going to be incredibly dangerous that's coming about in 2025, and I asked you, which people do you think would be most susceptible to that virus? Can you give me a list of the type of people you think would be most susceptible?
Probably the oldest and the youngest.
People that, yeah, exactly. People that have deteriorated immune system, particularly the very old and the very young. So if an average person like Tom, and pretty much everyone listening knows, yes, the absolute populations that would be most at risk for a virus like COVID would be like people like that are very old, particularly very old people that are in nursing homes, which by the very nature probably means that their health's not the best. What possible rationale, if me and you and Tom and average people that aren't virologists understand that those are the very people that we should be shielding against COVID the most, if we know that, how could the experts that are virologists be so wrong that they were like, you know what, let's send COVID patients right into that nursing home, which then had the predictable outcome of tens of thousands of people dying.
They weren't sending people that were COVID positive. They were sending people that were in COVID remission to the nursing homes.
Yes, people that still had active cases of COVID.
No.
That's not true at all. You're absolutely completely incorrect. That's just fundamentally wrong. They were sending people that they knew had active cases of COVID.
I don't think that was the understanding of the people that were sending them.
That is absolutely untrue. They absolutely knew that these people were diagnosed with COVID, and they were sending them to nursing homes.
That they had been diagnosed with COVID.
Right,
yes.
that they had COVID, that they currently had a case of COVID. Okay, so for example, let's play this game then. You've read a remarkable amount about COVID.
Just show me some evidence.
We'll get to that. I'll show you the evidence. You've read a remarkable amount about COVID. So let's say in April, May of 2020, how long were you infectious when you had a case of COVID?
How long were you able to infect other people for?
If you had a case of COVID.
They were, depending on the source, they were recommending 10 days to 2 weeks.
10 days to 2 weeks.
Initial symptoms.
Fine, we'll go with the upper end, 14 days. Yes, I'm absolutely telling you that they sent people into nursing homes within that 14-day period.
And their understanding was this person has active COVID that they can spread. We're going to send them to be around other people.
That's exactly right. That's exactly right. And the rationale that was given from people like Cuomo and others were, we were panicked that the hospitals were going to fill up. So we needed to create space for new patients that were coming in. So when we stabilized people, we sent them to nursing homes where they would have medical equipment that could help treat them. But they understood that they were still within that period of time that they were suggesting other people quarantine if they had symptoms. And the predictable results were that tens of thousands of people died. Then you saw with governors like Cuomo, what he did was he was caught intentionally trying to hide the numbers because they were ashamed at how bad it looked politically for them because there was no excuse. Now, I'm being charitable and saying the reason they did that was because they legitimately shit their pants with panic. But it could be that they're just corrupt.
Okay, you could just send me that proof.
Send you proof that they sent them within 14 days.
Because it seems like they thought that the people were going there and they were not able to spread it anymore. And then after finding that out, they changed what their policy was and then began to make them have a negative test before they could go, period.
All right, so I find it, I just want to say, I will look for this. I will try to find the specific evidence of this. It is incredible to me, though, as someone who has bragged.
But it's happening all over the place. You should have an abundance of evidence.
Hold on, Drazi, hold on.
I will bring up the evidence for it. You admit that the evidence exists. Now what you want me to do is find a very specific piece of evidence. That the evidence exists that they sent COVID patients, but I have to provide to you that they sent COVID patients only because they thought that they weren't infectious. That's what I have to do. And so I will look for that evidence and see what I can find. But it is amazing to me that someone who is a
I wouldn't ask you to send evidence.
Please, someone that is a self-styled expert who claims that has read everything at least for the first 2 years on this has been remarkably ill-informed in a great many of topics on this. I find that incredible. This isn't some topic I sprang on
misrepresenting
you.
everything I'm saying.
What's that?
You're saying that I'm saying stuff that I'm not. You keep saying that I'm saying things that I'm not saying.
Okay, then what?
No, I asked you to show me evidence that they were knowingly sending people to the nursing homes with COVID, with active COVID,
okay.
that they could spread. I didn't ask you.
So at the time, the like information was updating and changing pretty consistently, whether or not we knew that they were going to be infectious for 2 weeks at the time, or whether or not they thought that people weren't infectious anymore. I think that's what Drazi's saying is, yes, they may have done something that actually put people in danger, but they may not have had the right information.
So New York's law,
and after
New York's law that Cuomo signed on March.
After they realized that they had made a mistake, they changed it.
New York's law.
I get it. Sorry.
New York's law that they said that Cuomo signed on March 25th, 2020. It was an order that he issued that stated, quote, "No resident shall be denied readmission or admission to the nursing home solely based on confirmed or suspected diagnosis of COVID." The order was rescinded May 10th. In other words, they didn't say, "Oh, only people that had COVID cases that have cut out the infectious nature of it." The order was quite clear. Regardless if you had COVID or not, you could not, or if you had a case of COVID, that could not be a reason from preventing you from going into the nursing home. And so what happened was, because of that order, hospitals that were worried about their beds would treat someone for a day or two and say, "Now you're going to the nursing home," instead of isolating them. And the order was quite clear. Now, do you need more proof other than that order specifically said? Will you at least admit that order, the way it's worded, clearly says that nursing homes have no right to refuse active COVID patients?
Yeah, that's not what you said. You said they were deliberately putting people into nursing homes.
That's exactly what they did. You acknowledge that that's what the order said, and that's the practical effect of what happened. They took people that they knew had...
That's not what the order said.
Let me repeat what the order said, what you just conceded.
Just real quick, Drazi, I'm not even understanding your contention. Where you're saying deliberately, do you think they accidentally sent people to nursing homes?
Saying that the person who made that law was not... Because he said that they were intentionally putting people with COVID into nursing homes, knowing that they had COVID where it could spread, which is a hell of a lot different than saying knowingly. You can't bar somebody from going to a nursing home. Yeah, it's just a lot different than saying you can't bar somebody from entering a nursing home with COVID. Now, do I think that the nursing home should have had like really good response to this in making sure that they are quarantining people that are suspected?
Okay, so real quick,
but it's not the same as like them maliciously dumping them off there.
You're also claiming that they knew that they didn't have COVID at the time. Can you send that? Because you did say that there was something showing that they had like negative tests, or that they thought that they were in remission or something like that. So if that disagrees with what Rob
once it was shown to be a problem, they changed it. Yeah, once it was shown to be a problem, they changed their policy and made them get a negative test before entering a nursing.
Right. I think Rob's saying that there's like negligence there based on what information they did or didn't have at the time. And so if you're saying that based on the information, this wasn't such a ridiculous idea and that it made sense based on the information they had, you were saying earlier that they had information believing that these people were in remission and that they wouldn't be contagious anymore, right? So we would want that information, yes?
Seeing as how you're the expert who's read all this stuff, surely you can find that evidence. Now, I found an AP article. If that's, we'll see. It doesn't say exactly what you're looking for, but I think that we can intuit. But before we read it, I just want to say that you've already acknowledged that the way that this law or this order is written, yes, if someone had an active case of COVID, it would not be allowed from the nursing home to prevent them from coming in. Now your only argument is, but the way that would have been implied would have been they would have never sent active patients back to nursing homes. They would have waited until they thought they were no longer infectious. You have no proof of that. We know the law would have allowed them to send active cases of COVID. You're just making that assertion. And I could provide proof to the contrary, where medical professionals talk about how disastrous this policy was. So unless you think the medical professionals that will be listed in this AP article are lying, because you would say, oh, clearly these medical professionals should know that all of these COVID patients that were sent to nursing home were clearly no longer infectious. Unless you're willing to make that claim, how would you argue that the following medical professionals that I'm about to read to you seem to have a huge problem with this policy? Okay, I'll read it then.
I'm looking at AP article that you're talking about right now.
What's it titled? Over 9,000 virus patients sent into New York nursing homes? Is that the one you're reading?
Hang on.
Yes?
Yeah, that's the one that it also says at some point that AP did their own
Yes.
investigation and they came up with about 4,000 on
At
their
least
own investigation.
4,500 patients, yeah.
Yeah.
What this was people that were in nursing homes that got sent to hospitals because they had COVID, and then the hospital, because they were panicked that they were going to be overwhelmed, sending the COVID patients back to the nursing homes. So if you read some of the medical experts here, let's say, quote, there has never been any question in my mind that sending COVID-19 patients into completely unprepared, understaffed, and under-resourced nursing homes both increased transmission and led to a greater number of deaths, said Dr. Michael Wasserman, president of the California Association of Long-Term Medicine. While it may be impossible to know whether the additional 2,700 and change patients factored into the virus transmission in nursing homes, quote, any policy that is implemented that does not do everything it can to safeguard COVID from coming into a healthcare facility has the potential to increase and spread the virus, said Stephen Hance, president of a large nursing home group called the New York State Health Facilities Association. The months later disclosure, quote, further confirms the state's flawed approach in implementing a hospital-centric strategy to combat the COVID-19 pandemic. Other states set up nursing homes that were COVID only. The flurry of disclosures came late last month after Attorney General Letitia James, a Democrat, issued a blistering report accusing the Cuomo administration of underreporting its nursing home deaths by more than 50%. This was consistent with an AP report from August that focused on the fact that New York is one of the only states that counts just those who died on nursing home property and not those that died after being transported to the hospital. Geez, it seems like all these health experts are saying, my God, they were sending active COVID patients. This was leading to increased transmissions and deaths. And then Cuomo tried to cover up how many people died. But surely you would be there to say, no, that's wrong. They never sent active COVID patients. All of these medical professionals are wrong. And the fact that there was increased transmissions and deaths was purely coincidental. That's the argument that you're staking here.
No, you're right. It did look like they sent some. It did look like they were sending positive ones. I think the numbers that I got, or what I got, was from below the part where they changed the law.
Now they also did that in Pennsylvania. In fact,
also, I did say that.
Okay, I'm sorry.
I did say that I didn't agree with how the nursing homes were being ran, or how the nursing homes in general were a hotbed for death in general.
So my question then, going back to why we initially came to this, what would the possible rationale for that decision be other than over-panicking? Do you have any response?
Simply not having strong directives from the federal government on what to do, and people are trying to make their best guess at the situation. It would have seemed like a good time for the Trump administration to step in and do something about it when this was happening, wouldn't it have?
What would they have said? Do you think that the Democrats would have been fine with Trump issuing executive orders saying that Democrat governors are not allowed to do the things that they're doing?
It doesn't matter if they'd be fine or not. He still could have done it, right?
No, I don't think he could have. I think it would have been drugged to courts. I don't know that the executive would be able to force state governors to do certain sorts of policies on state ground like that. Furthermore, your answer is pure deflection. Like, even if you could say a lack of leadership meant that they had to make the best on their own. Okay, let's say that's true. And so then what was the rationale that went into their obviously terrible decision? The best faith to steel man their argument or their design position as much as possible would be they freaked out, they panicked. And you just don't want to say that because you think that hurts you in this debate, which it does. But it's a shame that you won't just be upfront, that clearly that would be the only possible rationale that's good faith, that's not treating them just like fucking monsters, was, look, they freaked out.
No, I'm saying that I don't know what the reason was. There wasn't information being given from the top to the states on how to handle this. If that had been the case, then we could have all had a unified approach in how we would be handling this. Do you disagree with that?
Yes, I absolutely disagree. I think that actually the preferable solution would have been allowed to have states deal with it themselves. Because, for example, states like California that would have embraced a far more stringent lockdown policy, they should have had the right to do that. If anything, I would have wanted the executive orders to go the opposite direction of you. I would have wanted them to say you can't lock down, which clearly state governors would have fought, right? Because I think the lockdowns were a net deficit. I think they were very harmful. And so you would have freaked out had Trump done that. I know you would have. You would have been like, Trump doesn't have the right to tell California they can't lock down. This is absurd. That's what you would have said. But instead you're saying, no, I think Trump should have had the right to tell all these states that they should have locked down, that they should have taken more stringent policies. I fundamentally reject.
That wasn't.
We're coming
my
up
question,
on an hour right now. The Drazi, based on the fact that the federal government did say they did leave it to the states to make their own decisions. Do you think that this was like a negligent decision made by the Cuomo administration?
Yeah, it seems like it. But my position has been that Trump administration did worse than the Biden administration did on COVID.
Okay, so
overall.
So we do have about 3 minutes left until we get to an hour. We can either keep going, or we can take call-ins, or we can end it there. But was there another Trump thing that you wanted to bring up, Drazi, before we get to that?
We can move on.
Okay.
I'm asking, is there another Trump thing, like another thing about Trump and his, or did you want to go to like call-ins or something?
No, I say we should probably move on. I don't have a whole lot of more time. Before this started, I thought we only had 2 hours. And my wife and kid aren't here. I gotta pick them up in a little bit.
That's fair. That's completely fair.
Okay. So there's other stuff.
So yeah,
I'll stick around and take calls
if you wanted to talk in the
want.
future, Rob.
Yeah, that's fine.
I have a little bit more time, but I agreed to take some calls. So I'm just trying to like.
Okay, so yeah. So if you guys want to do closing statements real quick, I think Drazi opened on this one, so that would make it to where
I close first. That would be fair. He gets the
you
last
go
word.
first. Okay,
that's fair. All right. So I think that, like, this isn't a topic that I'm very concerned with. I think that when you look at Trump's record, that absolutely he did terrible things, as did all leaders. I don't think any leader did it perfectly, but there's certainly a lot of room of criticism of Trump, and I'm not just saying that. I did it in real time. When I was criticizing Trump in 2020, most of my supporters or people that watch me are Trump supporters. Many of them were very pissed off. I think the fact that most of what he did that was wrong was embracing things like lockdowns, going after people like DeSantis and Kemp, which I think were a disaster, which helped him lose and helped lead to the situation we're in now. But certainly some of the things Elderdrazi say are reasons to criticize Trump. I just think that the over-panic was far worse and led to the worst outcomes that we're seeing. This isn't a topic that I think is particularly utilizing compared to whether or not lockdowns were good, whether or not vaccine mandates were good. If we're talking about Trump vis-a-vis someone like Joe Biden's big policy was, first, he said when Trump was taking the virus serious, saying it was coming from China and that we needed to stop people coming in from China, he said that was xenophobic. Then he questioned the efficacy of the vaccines, which I'm certain that Elderdrazi thinks the vaccines are the best thing that we could do, or the best thing we have going against the virus, as he seemed to intuit on the mandate section. And so the only one of those two that was against vaccines was Joe Biden, which probably sent the signal to millions of people not to trust the vaccines, which he's saying is something that would be terrible. And then once Biden was in office, what was his big plan to deal with COVID? Keep rolling out the vaccine that occurred under Trump. That's it. He really had nothing else going for him. And if you look at the same amount of time frame of Trump over the months he dealt with COVID, the 9-10 months versus 10 months that Biden dealt with COVID, despite the fact that his strategy was already in place, no thanks to him, of the vaccine existing, more people died under that time frame. So none of this justifies, I think, the terrible arguments that we see that we talked about in this section or the private section that would deal with lockdowns, mandates, etc. like that Elderdrazi specifically has to bite the bullet on because he supported that stuff. But that's fine. I was willing to let him talk about Trump and his hatred of Trump to be able to talk about it. I just don't think Biden did any better.
Okay, cool. Just real quick before Drazi goes, if there is anybody who wants to call in, you guys can join my Discord. I can put a link in the VC text if you guys want to post that in your chats as well. And then, yeah, if anybody wants to join, you just click the bald head to accept the rules, and then that'll make it to where you can join the waiting room and we'll pull you in. Drazi, you got 2 minutes.
I think that if you I think it's really silly to try to say that more people died under Biden when you look at the trends that were trends of deaths that were happening at the end of Trump administration. They just continued into Biden's administration as more time went on, and you could see when we see the shift happen, it's going to be after a bunch of policies that Biden put in place that were to help the pandemic, like getting 100 million people vaccinated. He did that really, really quick. Granted, I think that the best thing that Trump did in his entire presidency was Operation Warp Speed, and that is the one thing that I give him more credit for than anything by far. There's a misquoting of saying that Biden said Biden, and I'm assuming this extends to the other people that made remark, they weren't going to take the vaccine. I don't love that they said it the way that they said it, but they did say that if it was proven to be safe, effective, then they would take it. But they were concerned about the rapid speed in which it was coming out. So I don't think that your primary criticism for saying Biden did worse is valid. And I did, once the vaccines were proven to be safe and effective, did everything in his power successfully to get people vaccinated.
All right. As we wait for some people to jump into the waiting room, I do have a super chat from Trib for $10. He said, "What should America's response have been at the start of it? Perfect the vaccine, perfect in quotes. No vaccine mandates, military going house to house with vaccines, etc. Anything drastic or just small tweaks to it." So what do each one of you guys think would have been like the ideal response from the government? And Rob, if you want to go first.
Sure, no problem. I think that there are two types of viruses that could kill large amounts of people. One is a virus with a ridiculously high fatality rate that not a lot of people are getting. The other is one with a low fatality rate, but that it spreads a lot. So like influenza. Now, COVID clearly was worse than the average influenza, but it was along that lines where it has a very low fatality rate. But the risk we had of a lot of people dying was because it was highly infectious and a lot of people would get it. The way you deal with a virus like that is to protect your most vulnerable citizens, to provide resources into them, such as young people, people in the nursing homes, people with comorbidities, etc., and then allow herd immunity and natural immunity to spread through the healthy amounts of the population. So what we should have been doing was not taking away people's rights until we had almost proof positive evidence that it was necessary and the best policy. Instead, worked on educating people, providing resources to protect people that were the most vulnerable, such as those in nursing homes, as opposed to sending COVID patients into nursing homes, and allowed the virus to run through the healthier population, which would have got us to herd immunity faster. That would have been ideal. There are other things we could talk about, but in general, that would have been what I went with.
All right, Drazi.
I think the best proven methods would be to roll out testing a lot faster and do contact tracing as soon as it came into the United States. We're actually pretty fortunate in that the first cases that were coming into the United States, we had a pretty good idea of where they were coming from. When the boat, I'm blanking on the name of the boat, we could have had everybody on that boat tested. We could have had them isolated immediately when they got out of the boat, and then every new case that came up, we could have had contact tracing. Some of the best results were from the countries that did contact tracing, and it could have avoided us having to do lockdowns. But I think that rolling out tests, like immediately, the very first thing that should have been done was the Trump administration should have pushed through an executive order to use the tests that were perfectly good and usable, but just also tested for an extra thing.
Do you mind if I ask you a question real quick, Elderdrazi?
This would have been,
just real quick. Do you mind if I ask you something? When you talk about contact tracing, do you also criticize the contact tracing metrics that did things like purposely refuse to ask people if they went to Black Lives Matter rallies?
Yeah, that's retarded.
That's because you're aware.
If you're going to contact trace,
you're aware that
contact trace fully.
Yes, that you're aware that the experts, many of them, 4,000 experts that signed on to a letter that said COVID was bad, but you know what's worse? Racism. And they were routinely saying, actually, at the Black Lives Matter rallies, COVID's not spreading because we've done the contact tracing and we don't see it. And then we found out in many of the states where that was occurring, the people that were doing the contact tracing was barred from asking whether or not people had attended these sorts of protests. So I think the idea that we just needed more contact tracing in addition to the other things you talked about sort of belies the fact that a lot of that contact tracing was being done in the opposite way for political reasons. And so even having more of it doesn't seem like it would have done much good if we're not going to do it fully and openly.
I didn't suggest bad contact tracing, and also
I know that.
Contact tracing has the most effect. I think that contact tracing after a certain point in the United States was completely irrelevant. By the time that we really started doing any of it, it was so far gone that it was an absolute waste of time and money. We should have done it from the very beginning. You can really try to get a hold of things, and that's why the countries that did it first, they were able to stave off COVID for way longer than most other countries, and they were able to have time to prepare the resources. This is really what the initial contact tracing does: is it buys time to set a plan, like a national plan, and to prepare for where the virus is going to be spreading, and it eliminates the vast majority of the problems that we've seen in the first 6 months of the pandemic.
I just don't think that's true, and I also think there's problems with sort of privacy issues when it comes to contact tracing. I think there's a lot of problems with it. But.
All right. Tears in Rain, you're on mute. Can you unmute real quick and say something? Going once. Going twice. All right, we'll come back to him. Leader, can you say something real quick for me?
Hello.
Hello. All right. You have a question, sir?
Yeah, so there's this like hyperfixation, I think, on on the argument being like, well, it's people who have already caught the virus. But what my question would be, why is that important when one, there is like the virus, like the immunity once you've caught the virus degrades significantly with time, and two, there is like really good evidence to suggest that when people initially had that vaccine, it slowed down the rate of infection, thus sort of giving people more time.
So I assume this is for Rob.
Yes.
Okay, so two things. First, to answer your first question, while it is true that the rate of natural immunity did seem to decline over time, it declined at a less rapid pace than the vaccinations itself. And so we could see that almost all metrics, the initial protection that comes with a confirmed diagnosis of COVID versus a vaccine, in almost every criteria, the natural infection provided superior immunity when it came to your likelihood to get COVID, your likelihood to get a severe case of COVID, or your likelihood to have longevity in the protection that it offered. So while it could be true that you could say, well, you could go get a booster every 3 months, the problem is there's a lot of evidence to suggest with more onset boosters that you would get to try to keep up that protection every 3 or 6 months, that incurs all sorts of other problems, such as increased side effects and diminishing returns to where it's actually hurting your ability. And you can see this just anecdotally. How many people do you know that are on their 6th, 7th booster, and they seem to be putting out all the time, got COVID again? That seems to be far more common, and the data backs this up, than the people that have got, maybe get COVID once every other year or something like that. So that's number one. Number two, your second part of the question was, I forget. I'm sorry, it's not good form.
Well, let me throw one more at you.
Sure.
So, in Australia, in Sydney, there was a very sort of public blogging.
I'm gonna let you give the different one, but as soon as you ask it, I'm gonna move you out and allow him to answer it while after we move you out. But go ahead, sorry.
That sounds really great. Okay, yep, sounds good, Tom. So in Sydney, we had a public sort of like display of the amount of people who were like entering hospitals, their vaccination rate and their unvaccination rate, and who were going specifically to the ICU ward. And in these numbers, it was something like 95% of Australians, or up to 95, it was close to that figure, were vaccinated. And the beds that were sort of people who were going to the ICU beds were roughly 50-50 between unvaccinated and not vaccinated. How would you respond to this particular information?
It's data sets that we haven't talked about in this debate. So that would be a data set of people that didn't have prior cases of COVID and weren't vaccinated versus people that were vaccinated. What we can see is the people with the prior case of COVID had superior protection of those that were vaccinated. Now, probably if 95% of Australia was vaccinated, you probably had a lot of doubles in that. So if 95% are vaccinated and 50% of the population had COVID, that would mean that you would have those people that had both sorts of protection. That's something that would have occurred. But again, that's not what we talked about here. My issue and what I'm concerned with is why should you force things on people? The argument never made sense, even if you took the rhetoric of someone like Joe Biden, who was president, where he said, basically, there's almost no chance of you having a significant case of COVID if you get these vaccines and boosters. Okay, if that's true, and it does seem to be that much of the data that someone like Elderdrazi would point to would suggest that is pretty much true, then why do you give a shit if your neighbor doesn't get the vaccine if you have? You're protected. Do you say, well, that's because they're a burden on the healthcare system? Okay, then do we force fat fucks like me to lose weight because people like me that are overweight and that have high blood sugar are more likely to induce cost on average Americans by overutilizing the hospital system? How far are we willing to go with the authoritarianism to say that we need to force chemicals into someone's body? I think that it's disastrous. You absolutely should have the right to take the vaccine. I never gave anyone any advice that they shouldn't take the vaccine. And quite to the contrary, I haven't been someone that said that all the vaccines are evil and a conspiracy or something. I said my guess is there's probably a lot of people that are in specific health situations that the vaccine worked out for them, such as if you're an older person with COPD. Yeah, there are significant side effects that are downplayed, but those side effects are going to mean nothing to you if a case of COVID could have an incredible chance that you would be killed. And when you look at COVID, I think it was blown way out of proportion in many other ways. For example, I believe it still holds true in the United States. The average COVID death is beyond the average life expectancy in the United States. So it's something like 78 years old. Now, every death is tragic, and you don't want anyone to go even one day before they otherwise would have. But the idea that we forced this on young, healthy people, and there were significant side effects that occurred, and we took away their bodily autonomy, seems to be something that was disastrous.
Drazi, are you still here?
Yep.
Okay, thank you, Leader, for your question. I appreciate it. We've got a $5 dono from David. He said, Drazi, have you ever seen the video of Kari Mullis, inventor of PCR, saying that the test should not be used for diagnosis of infection?
I haven't seen the video. I've read about it, though. I don't think that he gives... I just don't think that he gives any information when he suggests that trumps the fact that we are able to detect the virus. It's not nearly as effective in the beginning of detecting it. And if that was the reason he can test it, that's fine. But that's why we also had rapid tests. I think the PCR tests are totally fine, and he doesn't present any clear challenge to it.
All right, we're gonna take a chance with this one. So he's been in the waiting room, so we'll. All right, Saxon, we'll have you ask your question, and then we'll move you out. Go ahead and tell us who your question is for and what your question is, please, sir. Saxon, going once, going twice. All right, and then we've got one more dono here. If you guys have any, you can let me know as well. Trib donated another $5 for Rob. He said, do you feel you were unfairly dogpiled in this debate? Was Tom a fair moderator? All right, I don't know.
No, it's fine. I'll answer the question. No, I think Tom was a fair moderator. Let me be totally upfront with him. Yeah, I was being a little pissy with Elderdrazi, and as I admitted on my channel, probably comes off as me looking like a pisshead. None of it's as bad as Elderdrazi trying to gaslight the audience that I would not accept any of his subtopics when literally one of the two agreed subtopics was one he specifically said in lockdowns. But nonetheless, if you understand the position I come through, which is the last time I was on with Elderdrazi, it was basically Progressive Victory Pack ran the whole show. The moderator jumped in against me. I think that Tom probably ideologically is against my position and leans more to Elderdrazi on this. And yeah, I didn't think it was a big deal. I made one snarky comment on Twitter, and then Elderdrazi, I quote, begged for me to release the DMs. I said, okay, sure, here's the DMs. I didn't give a fuck or feel strongly about it. I think that this debate shows that I was obviously prepared to debate any topic that Elderdrazi wanted or a subtopic. It just felt like needy bullshit to me. And did I come across as more of a fucking crybaby by pointing out to him in DMs it felt like needy bullshit? I guess. But I don't really give a fuck, and I was prepared to do well even if you weren't a fair moderator, which I thought you were.
All right. That's all
really
the people
I
have
wanted to be the one to point out that you were a fair moderator.
Do you mind me asking, Drazi? Do you concede that you were, we'll be charitable, not that you lied, but that you were mistaken when you repeatedly said that I refused to debate any of the subtopics you outlined?
I was being like catty about it because you picked one out of all of them, and then you said I'm only going to do these. I basically just shit talking. I wasn't trying to lie or misrepresent. I just,
I don't get, buddy. I thought it was fine. I'm not upset.
Some of your aggression with my own.
That's perfectly reasonable.
No,
and
I'm just telling you.
That's fine.
Yeah,
do you understand though why
it's hard to read this kind of thing on Twitter?
I agree. Do you understand why I thought 2 subtopics was the maximum? I mean, we could have went with either of these topics for probably 3 hours. Would you agree with that? So I mean, to have a list of 4 subtopics and then say,
that's what I
and
wanted
add your own. I mean. That's it. I'm not mad. It's fine. Yeah, I was being a little catty. And if I'll be honest with you, it's clear, I think, to anyone who's watching me even today, I'm not having the best work situation here lately. So I've been a little pissy. And yeah, I guess I apologize if it offended you. I didn't give a fuck, though. I think it's funny. It's like 2 boxers. A little shit-talking beforehand to raise the fucking, viewership. That's fine by me. I don't mind it at all. I didn't take it personal at all.
Okay,
I don't mind so much the public aspect of it, but on the individual level, that's just how I've always set up debates with people. I was going to hit you with a bunch of stuff ahead of time because then it sounds like I'm presupposing that you're agreeing, which feels like weirdly aggressive to me.
I mean, for me, the way
hey, do you want to? Okay. Hey, by the way, here's like things that I'm looking for. That's it.
Okay, whatever. I don't have anything more to say on it. I just thought that it was one of these things where I'm really busy, and I just, I swear to God, I'm just so tired of dealing with fucking so much of the streaming shit that I deal with when I actually get the 2 hours of my day that I can hang out with my family. And it went from, this will be easy, we'll just go on and talk about whatever the fuck Elderdrazi talks about, to well, now we need to pick a moderator, now we need subtopics, and we need this and this and this. And I'm just like, okay, what the fuck is this that we have to deal with now? But okay, ship's crossed. I don't give a fuck it worked out. I hope you're not upset about it. If so, I apologize. I was catty. That's it. I don't have anything more to say on it.
All right, cool. Yeah, appreciate you guys coming on. That's all the donos and people in line that I have. If you guys said you don't have any donos or any questions, right?
I may have, but I don't see any. I'm afraid if I go to YouTube to look, my computer will fucking explode. So
fair enough.
No.
I will say, in my own defense, you are totally right. I have a liberal bias, and I am definitely biased. I feel like I can moderate in an unbiased way, but I have biases for sure. It's
no one can be unbiased, but I thought you did completely fine in hiding your bias. So.
All right. Yeah, that's it. Appreciate you guys.
Just as a show of good faith, and I'm pretty I do this a lot. If you ever want some any kind of help with, I probably help you figure out what's wrong with it remotely. I've been in IT for 18 years. I've helped a bunch of other streamers with their computer issues. You have a lot that sometimes you have to go to work to do it and your computer overheats like that. Just hit me up. I won't charge you anything. Okay. Any streamer that I've ever interacted with, I'm more than willing to give you my professional opinion for free.
Thank you. I may do that. I've taken it to the shop several times. They can't figure it out. So.
Awesome.
All right. I'm going to head out, guys.
My specialty.
Cool. Thanks, guys. It was fun.
Have a good one.
Yep. What do you think? I'm going to try to be nice here. Expert? I mean, Elderdrazi did say I was going to be taking another L tonight. I'll leave people be the judge of it, I guess. Can I please address the Pisco William wager on X? Who's got to pay? First off, I would appreciate... I don't mind. I'm not heavily offended. No one ever make monetary bets on what they think I'm going to say. I don't want to be responsible, even if it's for just $5 or something, for one person that I like or dislike having to pay someone else. So I would appreciate... not being involved in that sort of thing. Yeah, Tom. We'll talk about this in a sec, but I will address this. The specific question that was asked, which, Pisco is, again, let me be honest. I don't mind saying this. I like Pisco. He's such a sack of shit for how he operates his X account. It's so ridiculous. So he's like, I got evidence. Stay tuned. In the next following days, I'll release evidence. Dude, if you have something you want to talk about, just release it. It's constant with him. He won't respond. He quote tweets instead of responding. He immediately retweets every fucking thing that he puts out there. It's impossible to follow a linear conversation with him because he's bouncing all over the place instead of just responding and just quoting. And it's fucking ridiculous. I just get so tired of the bullshit. I already said one time in response to Pisco's shit what I had to say to it. He was on the chat while I was talking about it. He wants to come on and talk about it sometime. That's fine. But I'm not going to keep every day when he says, stay tuned, more earth-shattering shit coming up. Rob, are you going to respond to Pisco? Nah, I'm not. I don't give a fuck anymore. It's no better than like the, The specific question, though. So the point is that William said that I would acknowledge. Thank you so much, Roar89. Rob, this guy was a joke. You're above. We got to get you some better debates. The moderator was fine, though, even if he's a lefty. I agree. Tom did fine. I thought that I did very well in the debate as well. We'll talk about it more in a second. So the specific question is, this William seems to think that I will concede that based on the Graeber definition that Pisco gave, that January 6th was an insurrection. Now, Pisco's more than willing to pay $50 because William, what he doesn't understand is optically what people like Pisco and Destiny want desperately, more than anything. They want a clip of me saying, insert any definition, it could be anything. January 6th was an insurrection. That's what they want. So William puts me in the unenviable position of, in order for him to win this $50, I have to give Destiny, Pisco, all the lefties the optic victory that they want. Or I say no, and then a supporter of mine loses $50. Does everyone see why this is a bad idea to do? But to answer the question specifically, because if I'm nothing if not good faith, right, I will say this. January 6th was 95% most likely an insurrection given the Graeber definition, a definition that I think is overly broad and should not be applied. But it was almost certainly an insurrection under that definition, which I again think is a shit definition. I know this will be clipped out of context. Thank you so much, William, and all those in the chat that have insisted that I answered this question for giving them that. I really appreciate you guys helping me across the finish line here, and I know this will be taken out of context. I cannot stress this enough for the people that want to hear the full context, that the Graeber definition is shit. And the problem is that it is too broad, and the problem is that it is overly applied, or it is only applied to one side in a biased sense, and that we have a two-tiered justice system. But none of that will matter because, thank you so much, William, I just gave them the clip, the 10-second clip that they'll want that says, under our definition, January 6th, Rob says it's most likely an insurrection. There is a brief caveat. That caveat would be whether or not the idea of the second part of their definition that says that's challenging a law or protesting a law. They're not protesting the sort of ability to count electors. They are protesting the way the electors were counted. In other words, they're not saying we're against the law or the way that the law is carried out and having electors decide who will be the next president and having the vice president count it. We just think that they're counting the wrong ones. But I would say that Graeber would probably say, no, I'm more expansive. I'm not just talking about protesting the actual law existing. I would also protest the way the law is enforced. And if that's what they would say, then it would be an insurrection. So thanks, guys. I really appreciate people putting me in those positions, though, so thanks. So again, I repeatedly say, done talking about January 6th, and of course the Democrats are like, talk about January 6th, January 6th, January 6th, January 6th, and it sucks to have my own supporters say, yeah, Rob, more on January 6th. But there's where we are, so enjoy your $50, William, or whatever you get from Pisco. I don't know. So clip it, do whatever the fuck you gotta do, get it out there viral. Now I'll have, 50 DMs tomorrow saying, Rob GPT admits January 6th was an insurrection. There you go. So you guys did it. You got me to talk about it. Great, grand, awesome. You did it. Now, this debate specifically, I guess the only thing that I thought morally that upset me with people about the COVID thing was people that wanted authoritarian actions on people like lockdowns, vaccine mandates, etc., that were ill-informed, that were just people that were just, well, I trust what they say, and so therefore this should occur. I think that's monstrous. I think that before you suggest that other people's rights be taken away, like their right to work, that you ought to be damn certain that you're correct about what you're saying. And it seemed evident to me that almost everyone that supported those positions didn't have a reason to do that other than they were scared and they believed what they heard people saying. So when I'm debating someone who says, well, I've read pretty much everything. I'm a COVID expert. This is my ideal topic. This is my best topic. Okay. Then let's hear it. Where was the data you were looking at the time that you supported lockdowns? Where was the data you were looking at the time you supported vaccine mandates? And he brings nothing to bear. I'm not the expert. I'm not even at my home fucking computer where I have my COVID research. I just, before I came on, 5 minutes before I came on, was like, well, I know this one thing that I wrote. I know where to find that, so I'll go to that, and it links 4 or 5 sources, so let's start there. That's it. That's all I had. And what's striking to me is he didn't even seem to know basic things, like the nursing home situation, sending COVID patients to nursing homes. How can you claim that you're, like, ridiculously informed on a subject, and you don't even know things that were, like my friend Tom said there, that were, like, main news cycles for, like, 3 months? It's just frustrating to me. That's all. And I'll admit, I'm a little unimpressed by Elderdrazi. I'm not saying he's a shitty person. I'm not saying that. I just felt that he didn't live up to my expectations. Now, I'll be honest, I expected to do very well in that debate. Even if he did well, because I think I'm right. I'm right on the issues, and I think I'm a good debater. So I think that I expect to do well. Particularly when I know I'm right on the issue, and I think I'll do well. But he did not do as well as I thought he would, even despite that. This was a debate that he had been asking for over a month since I did that Progressive Victory panel. I thought he was going to be like, bam, research. There's like nothing. Like, I mean, he talked about a CNN article that was times that Trump said COVID's not that big of a deal. That's it? I don't know. I was not very impressed. I don't know. And I think that he's saying some stuff that's really questionable. Like saying, like, yeah, he would be fine forcing people to get the vaccine if he knew that there was a 10 times greater chance that they would have an anaphylactic allergic reaction. That's fucking crazy. That's crazy. Like, and I don't think Elderdrazi is particularly a bad person, but you have to understand, once you're willing to rationalize, we could cause individual harm to you for the greater good, you're going to a very dark place. Like, very dark. And that's why one of the things that scared the shit out of me, like, it was just, part of you could rationalize people out of fear suggesting things, but it doesn't belittle how bad it is. Because you could see real quick how authoritarianism could instantly come overnight. If you scare people enough, well then all of a sudden, take COVID out of it, take a pandemic out of it. Let's say that we get scared of the Muslims again because of terror attack. What would people be willing to do? Break in the mosque. Spy on all these people. Really? That's where we're at? But it went further than that. People forget the glee that people had during COVID. Reporting on their neighbors for having too many people at their house. Tim Walz set up a hotline. VP candidate. The mass reporting that I would get anytime I used the word COVID on places like YouTube that would lead to community guideline strikes. People wishing me death or wishing me infection. Why? Did I say don't take? No, just saying I'm against mandates. And so it is, given all the pain that I saw caused by things like lockdowns, not just in my personal family, but also in my work, seeing how many people I served with autism and other developmental disabilities that were tremendously negatively affected by lockdowns those sorts of things. Anytime I talk to someone who is very passionate in the support of lockdowns or vaccine mandates, I like to grill them a little on why they came to that rationale. And does anyone think he had a good reason? I'm in the same position, Mr. White. My son was born during COVID, same thing. His doctor was pretty cool, though. We were immediately like, no. I don't know, Baba Yaga. I don't know the law on that. But anyways, that was the debate. So I hope people enjoyed it. I can't say what's next for me streaming-wise. For those of you that are tuning in late, I never set up discussions or debate unless I know I'm going to be in my home office. Because even though I'm off the clock here, tons of things could happen where I have to clock back in and leave early. My computer sucks here. My internet sucks here. I got called into work through a situation. And unfortunately, I have no idea when I'll get to go home. So I could be here for weeks. I just don't know. As such, I can't make any promises for like upcoming debates or upcoming streams. I'll try to stream when I'm off the clock when I can. But I have no clue. I haven't even had time to process it. I talked to my friend Tom a little on my way to work. I literally got home from having fun, called a coworker, realized I had to come into work, talked to my friend Tom, got here, did the work stuff that I needed to do, and then immediately started this. That's it. So I haven't even had time to think about what's going to happen. I felt strongly to both Tom and Elderdrazi, despite all the shit talking that went on beforehand, that I did not want to go back on my commitment to do this debate tonight, particularly when I have no clue when I could have rescheduled it. So I'm happy that the debate went off without a hitch, that my computer didn't burn out. I hope people found it entertaining. I enjoyed myself thoroughly. I very much enjoyed the debate. I thought Tom did fine. I thought despite the chippiness that me and Elderdrazi had beforehand, that it went off pretty much without a hitch. A little chippiness during the debate, but that's okay. And I thought that I kicked ass. So all good for me. Now, clearly I'm subjective, but I think even if you disagree with my positions on COVID, I think you would think I got the better of Elderdrazi there on almost every topic that we were talking about. So I even let him talk specifically what he wanted to talk about in the second topic. Am I going to stream the sentencing results? I don't know, man. Who knows where I'll be? Depend if it's during the day, then no, because I'll be working most likely. Yeah, I enjoyed it. I hope everyone else did as well. Thank you, Roar, and anyone else. If I missed any super chats, I am really sorry. I really am. In the heat of a debate, oftentimes it's hard to read the chat. Oftentimes I find that it distracts me. So nothing intentional. So, but I hope you all enjoyed this. I'll try to do some little stuff Monday. Maybe try to stream from my phone or whatever. But I do appreciate all of the kind words, all of the support. Really means a lot. So you guys are the best. All right, done. Him and Han. I'm going to get out of here and call my wife and see what the plans are for my future. But you guys are the best. Again, I hope you enjoyed it. Special thanks to my editor, Black Elk, who I know will be clipping this. And you'll get to see fun little 5-10 minute videos from this debate probably for a couple days. So it should be fun. So thank you so much, everyone. I'll talk to you all soon. As always, have a good one.